Croeso I bawb I gyfarfod Bwrdd Ymddiriedolaeth Gwasanaeth Iechyd Gwladol Prifysgol Velindre. Welcome all to Velindre University NHS Trust Board meeting. Fel aelod o'r cyhoedd, gallwch fynychu'r cyfarfod I arsylwi. Mae hynny'n golygu y gallwch weld a chlywed y cyfarfod, ond ni chewch gyfrannu. Rydym yn recordio'r cyfarfod a bydd cofnod ohono ar gael ar ein gwefan yn fuan. O ganlyniad, gofynnwn yn garedig I chi beidio a recordio'r cyfarfod os gwelwch yn dda. As a member of the public, you can attend the meeting as an observer. That means that you can see and hear the discussion, but cannot participate. We intend to provide a video recording of the meeting, which will be available on the website soon after. For that reason, we ask that you do not record the meeting yourself. Hoffwn gyflwyno aelodau annibynnol o'r bwrdd. I would like to introduce the independent members of the board. A'r prifweithredwr ac aelodau gweithredol ac anweithredol o'r bwrdd. And the board chief executive, executive and non-executive board members. Hoffwn gyflwyno nawr gadeirydd y bwrdd, yr athro Donna Mead OBE. I would now like to introduce the chair, Professor Donna Mead OBE.
Good morning, everybody. Actually, my name is Stephen Harris. I'm the Vice Chair, so I'll be chairing this board meeting this morning because Professor Donna Mead has unfortunately become unwell in the past couple of days and is unable to attend herself. Let's note that this is the first time Donna has been unable to chair a board meeting since her appointment in 2018. So I know it's a decision that she's not taken lightly, but clearly a decision she's taken very sensibly in terms of her own health. So as I say, I will be chairing the Trust Board meeting this morning on behalf of the Chair, Professor Donna Mead. So welcome everybody. It's the July 2023 meeting of the Velindre University NHS Trust Board. I'm pleased to confirm, as was mentioned on the slides, that this meeting is being live streamed today for those joining the meeting remotely. I understand there are some members of staff, members of the public who will be joining or are joining the live stream. And the recording of the meeting will be made available on the Trust website for any members of the public or members of staff who wish to view that recording at their own convenience. So for all who joined the meeting today, a very warm welcome to all of you. Croeso pawb. Thank you for joining us today. Before we start the main items on the agenda, we're going to start actually with a presentation. I'm going to welcome Professor Peter Groves, who's Chair of Health Technology Wales. He is going to take the Trust Board through the Health Technology Wales annual report. Those who aren't familiar, Health Technology Wales is an all-Wales health body which is hosted by the Trust. But it is run independently, so I welcome Professor Groves and invite you to take us through this annual report, please. Thank you.
Chair, thank you very much indeed for that kind introduction and for inviting me to present the annual report for Health Technology Wales to the board this morning. Can I just first check that you can hear me okay? I'm a clinical cardiologist. I'm presenting to you from the outpatient clinic, so I just want to make sure that my connection is stable enough for you to hear me. Can you hear me okay?
You can, yes, thank you.
That's good. So apologies if from time to time the sound goes in and out, so the Wi-Fi is sometimes a little bit unreliable, but I'm sure we'll get through fine. I'd be grateful if somebody from your end could share my slides for me. I think Madupa, you were going to do that. That's kind. Thank you very much indeed. So I'd like to present to you this morning the annual report for HTW on behalf of my colleagues. If we could go to the next slide. And in beginning, I would like to introduce you to our team. So here are the Health Technology Wales team members, an enormously talented group of individuals, very dedicated to their work. under the able leadership of my colleague, Dr. Susan Miles, Director of HTW, who unfortunately can't be with us this morning. But I wanted to start by firstly acknowledging their enormous contribution to the work of our organisation, and also to publicly thank them for their dedication and hard work. And many of the achievements that I'll be talking about in the next few minutes could not, of course, have been accomplished without their dedication to our cause. So thank you to them. Next slide, please. So by way of reminder, Health Technology Wales, as you've heard, is an arm's length national organisation with a remit to provide a strategic, streamlined and nationally coordinated approach to the identification, the appraisal and the adoption of medical technologies across NHS and social care Wales. And our remit includes technologies that are anything but a drug, pretty much. I'm going to touch on each of these core responsibilities, the identification, the appraisal and the adoption separately in my report. We are funded by Welsh Government, and I want to also take this opportunity to thank our colleagues at Welsh Government for the support they've given to us over the last 5 years. Our budget over the last 2 years has been increased at times of financial hardship, so we're very grateful for that, from £1 million per annum to £1.65 million per annum. And this has allowed us to increase the size of our organisation from staff numbers of 20 to 30, which is now equivalent to 28.5 whole-time equivalents. Next slide, please. In regard to the identification of topics for our consideration during the last financial year, 155 topics have been notified to us at Health Technology Wales. Our organisation has been in existence now for just over 5 years, and throughout that period of time, 463 topics. So an awful lot of work to consider, from which we have to select those that we're going to pursue with full appraisals and publication of national guidance. Just looking to the left-hand side of the slide first, if I may, you'll see that for the last financial year, the majority of our topic notifications have come from industry colleagues, less so from clinical colleagues in NHS Wales, some from academia, some from Welsh Government, third sector and individuals. We feel that the high level of notification from industry reflects the relationships that we've developed with colleagues in the life sciences industry and the trust that they give us in our relationships with them. But as I'll touch on a little bit later, we really would like to see a growing number of notifications to us from colleagues in the clinical and social care sectors to ensure that our work is really focusing on areas of greatest people and patient need. Just looking to the right-hand part of the slide, if you would, this merely summarises the fact that during the last year, we've had topic notifications from all of the 7 local health boards in Wales, and also from our specialist health boards, including, of course, Velindre. And if you look carefully at the pie chart, 7% of our referrals from the NHS came for Velindre in the last year, for which we're grateful. Next slide, please. During the course of the last financial year, we have published 10 pieces of national guidance, which are summarised on this slide, covering a wide range of conditions, moving from the top: depression, cancer, management of blood transfusion, out-of-hospital resuscitation, again, the diagnosis and treatment of certain cancers, the management of heart rhythm disturbances, treatment of wounds, visual distraction therapy for managing pain for children and adults undergoing procedures, and also photobiomodulation for the prevention of complications of treatment for cancer. So a very wide-ranging variety of conditions. Amongst these, 4 of them, you'll have noticed, relate either to the diagnosis, management or prevention of complications from the treatment of cancer, very pertinent, of course, to your organisation. So next slide, please. So really, just to illustrate the value of the work that we do, I'd like to pick 2 examples that are relevant, particularly to the Cancer Centre. Extreme hypofractionated radiotherapy is a way of delivering radiotherapy in more intense, short sessions, which reduce the number of treatments that are required as compared with conventionally fractionated radiotherapy. And we did an assessment of the application of the EHFRT for short technology in the treatment of localized prostatic cancer. And from that, we concluded that the evidence tells us that this treatment reduces the number of visits required for treatment and yet gives equivalent clinical outcomes, importantly, for patients with localized prostatic cancer. We did a health economic analysis and showed that the treatment can be delivered cost effectively. And so we were able to issue supportive guidance for the routine adoption of this technology within Wales. And we were pleased to learn from colleagues within Velindre that this positive guidance is likely to have a significant impact, if implemented, on increasing capacity for the treatment of patients with radiotherapy within the cancer centre. So very helpful and likely impactful guidance from HTW. Next slide, please. In a separate appraisal, we learned that for some patients with kidney cancer, conventional surgery and ablative techniques is not feasible or possible. Conventional treatment at the moment would be surveillance conservative treatment. But what we discovered was that the use of stereotactic ablative radiotherapy, which is another form of delivering radiotherapy in very localized, precise targeted locations to the cancer source, can lead to improved survival as compared with conventional treatment, and can be delivered cost effectively as well. So again, having looked at the detailed evidence, we were able to support this particular intervention for routine adoption. And again, we learned from clinical colleagues that this is likely to have significant impact on the lives of some of your patients. So next slide, please. In the work that we do in preparing our appraisals and guidance recommendations, we rely very heavily on the input of clinical experts, but I did want to focus just for a moment on emphasizing the role and importance of patients, members of the public, in the work that we do at Health Technology Wales. Our patient and public involvement programme, our PPI programme for short, is now very well established. During the last year, our colleagues have advised on different methodologies to support particular specific appraisals. So, for example, we've received 3 patient evidence literature reviews. We've had 4 detailed patient submissions, and these have very much added quality and evidence to our decision making from the perspectives of people suffering with relevant conditions or members of the public as well. So this is a very well established part of our work, growing from year to year in terms of its impact. We use our PPI input into every aspect of the work we do at HTW, and we're very grateful for those that give their time to this. Next slide, please. It's important always to think more broadly about the potential impact of the work of our organization. This slide summarizes, for example, an estimate that our team have made that if all of the guidance that we've published between 2017 and 2022 were fully implemented across the health and care system, then we estimate that more than 365,000 patients per annum would benefit from that guidance. And next slide, please. When considering the relevance of our guidance and the impact of our guidance, it's important to think about what decisions that we can make. So in the since 2017, almost 6 years now of the organization's life, we've had 56 topics progressing to evidence appraisals, and from those we've published 33 pieces of guidance. And when we publish our guidance and make our decisions in terms of whether or not the evidence supports routine adoption, essentially we have 3 decisions to make: either yes it does, or no it doesn't, or sometimes in the middle, well perhaps, but for selected groups of patients. And if one looks at the decisions that we've made at HTW, with the middle pie chart firstly in regard to the last financial year, and then secondarily the right-hand pie chart in regards to the 6 years almost of our existence, then you will see that routine adoption, which is the dark blue, and insufficient evidence, in other words, a no, represent the majority of our decisions, so between 84 and 90%. And only in the minority of cases, really, do we have to perhaps sit on the fence a little bit in regard to the evidence. So in terms of guidance for the system, whether it be the health or the social care system, we've got good data to say that we are being fairly definitive and clear in our guidance, either to say, yes, you should use this technology, or no, really, the evidence doesn't stack up. Next slide, please. Our job doesn't finish, though, with just preparing our appraisals, publishing our guidance. A very important part of our work is to promote the adoption of our guidance within the health and care system. The Welsh Government, who fund us, expect that those who provide care will adopt our guidance, and if not, justify why not. We now have a very well-established mechanism, not just for promoting our guidance uptake, but also for auditing the uptake amongst those who provide services. And we're very grateful to colleagues across the system, the 7 local health boards, the specialist health boards, for the support they give to this audit work, which has now entered its third year. Next slide, please. I just want to give you a highlight of the findings from the audit just this last year, which in fact is going to be published in the next few days and will become public knowledge. But the process for this year was that we were able to look back at the adoption of 14 pieces of guidance across NHS Wales, guidance that was published between 2019 and midway through 2021. 11 pieces of HTW guidance, but also for the first time, 3 pieces of guidance coming from the Medical Technology Evaluation Programme. NICE, equally important for patient care as our guidance. We have a well-established process. We have fine collaboration from those who provide the service. And this year, we received responses from 6 out of the 7 local health boards and from the Specialist Commissioners WISC. I should add that none of the guidance topics were relevant to cancer and to the work of Velindre. So just for clarification, there was no need to get responses from Velindre. But as you have seen from guidance that we've published just this last year, future audit cycles will very much depend on the engagement with colleagues at Velindre as well. And we had supportive evidence from procurement as well, who supported this process, for which we're very grateful. And the high-level results tell us that there is a high awareness of HTW guidance within the system, that it's considered that there is a high level of clarity about our guidance, and that there is an impact in the majority of cases, almost 3/4 of cases. There's also useful feedback with this process on the barriers to adoption. So, for example, we've heard about challenges with funding. We've heard about challenges of creating professional networks for referring patients into relevant centres. We've heard about challenges where the topics really impact on a relatively small number of patients to create services to deliver that treatment. And also the whole concept of delivering change, where technology is already well established, and the new technology that we're supporting is going to require a change that may be difficult to deliver at the moment. So lots of lessons to learn for the future. Next slide, please. I just want to finish now by thinking more broadly about the role of HTW. In addition to the work that we've been talking about at a Wales level, we are now very much a well-established international health technology assessment organisation. During the process of supporting the pandemic, we were part of the Welsh COVID-19 Evidence Centre. Just this year, we've been appointed as one of the collaborating partners of the Health and Care Research Wales Evidence Centre, which will support healthcare strategic planning and policy making by Welsh Government to ensure that the very most up-to-date and robust evidence is available to them in that decision making. We're now one of 6 international health technology assessment organisations that have a formal collaboration across continents. So joining colleagues in England, Canada, Australia, Scotland, and also colleagues within the pharmacological sector of Wales to ensure that HTA methodologies are shared between organisations, between countries, to improve efficiencies of the work we do, to learn about horizon scanning and picking topics that are relevant to different communities and different parts of the healthcare system across the world indeed. Next slide, please. To celebrate our 5th year, we had a celebratory event in November last year, which was attended by many of our partners and collaborators. We commissioned an independent report for that event, and this was undertaken by Mark Campbell, an independent health tech expert. And he concluded from that report that Health Technology Wales is really well established now as a valued and trusted member of the innovation pathway and the innovation community within Wales, and that maturation has happened progressively over the last 5 years. We were delighted by Eluned Morgan, Minister for Health and Social Services, who gave a keynote lecture to the meeting, and she very kindly identified the pivotal role that HTW now plays in ensuring the correct decisions are made around the selection of innovative technologies that are going to be of greatest benefit, but also greatest value to the people of Wales. Next slide, please. We're very eager as an organisation to support the Minister, to support Welsh Government and the health and social care deliverers in the delivery of the ministerial priorities that, of course, we're very familiar with and have been announced over the last few months. And to do this, we're adapting our processes for coming months and years. We're trying to find new ways of identifying topics that are going to be particularly relevant to supporting technology-based pathways that will help with the delivery of these priorities. New methods of horizon scanning using, for example, the international collaborations that I've already talked about. Our appraisal looks at evidence from lots of different sources, and we adopt a permissive approach. We're going to be looking at ways in which we can adapt our appraisals and our recommendations to include evidence gathering in the context of a very rapidly moving service. And by strengthening the links with those who deliver services, we hope that early adoption of our guidance recommendations will be achieved. Next slide, please. So I'd just like to finish also by thanking colleagues within the Velindre organization for the strong support they continue to give the work of HTW. Particular personal thanks to Steve Ham, your Chief Executive, to Donna Mead, your Chair, to Jacinta Abraham, Medical Director, and also to Tom Crosby, who sits on appraisal panel. Their individual support in terms of supporting the growth and impact of our organisation is both much achieved, much appreciated, and has been very significant. So thank you to you all. Diolch, thank you very much indeed.
Thank you very much, Peter. And to the board, will echo your thanks and appreciation to the colleagues you've mentioned in your concluding remarks in terms of supporting of you. I'll make sure that's obviously conveyed to Donna as well. So thank you. I know it's also very challenging, of course, to try and capture an entire year's activity and success in a short document and in a short presentation. You've taken us through that very succinctly and very clearly. So thank you for that as well. So the report is here for noting. We've also got in our papers the 5-year review by Mark Campbell as well, which is say very interesting and encouraging read. So I'm just going to look to the board colleagues now for any comments, questions, observations. I think, Andrew, I think you were first.
Thank you. Thank you, Peter, and congratulations to your team on your 5 years of really establishing this programme. A couple of things from me, just for curiosity, really. When you say publication and you get to the end and you publish, that is normally through the website. How often do you get involved in, I'm thinking about broadening the reach and impact, or international peer-reviewed journals, that sort of thing. Do you go there routinely, or is it just not usually a web based on your website?
Thank you for that question. All of the guidance, as you quite rightly say, is published on our website. We also publish other outputs. In addition to our guidance, we create a large number of what we call topic exploration reports, which are high-level evidence summaries of topics that are potentially of merit, but which don't quite satisfy the criteria for a full appraisal. So there's a lot of evidence summaries that are useful for people to dip into as well. In the majority of cases, we don't publish elsewhere, but there are some exceptions to that. For example, during the COVID pandemic, we did a large piece of work on summarizing the accuracy, the diagnostic accuracy and impact of different modes of testing for COVID-19, for the coronavirus. A piece of work, a systematic review that we then published in BMJ Evidence, a very high-profile journal that was available then to the worldwide community. And we know that that piece of work informed strategies and policy in other countries, not just our own in NHS Wales. So that is an example, for example, where we were able to share that information more widely. But that requires a whole different approach, as you can imagine, in terms of document preparation, and it's not feasible to do that with all of the guidance that we undertake. There are a number of collaborative reports that we contribute as well to, that I haven't had a chance to touch on, both with colleagues in Europe and more internationally. So we've co-authored a number of reports, both during COVID particularly, and outside of the pandemic. So those, of course, have been published as well more broadly. But also just to emphasize that we do have quarterly bulletins which summarize all of the publications that have appeared on our website at HTW, which are circulated widely. And in fact, we prepare that collaboratively with colleagues in Scotland as well. So that is circulated widely amongst all of those who deliver care within Wales, so that people are made aware of new publications when they come along. not a formal publication in a journal, but just raising awareness of what we're up to.
Thank you. If I quick thought. So I was also wondering, clearly do routinely scientific evidence-based appraisals. How often do you look at economic resource implications of introducing, let's say, a new technology or a new process into NHS? Is that part of the remit, that so-called economic analysis?
You're absolutely right, it is. It's a fundamental part. Again, I didn't have a chance to go into the minute details, but you'll have noticed that I paid reference in both of the two case examples that I gave of guidance that we produced on the two different forms of radiotherapy, both to evidence to support clinical effectiveness, but also evidence to support cost effectiveness. We are very fortunate to have a group of very strong, experienced health economists who work with us at HTW in-house. So we're able to do all of our own health economics, which is unusual actually for an HTA organization. But that means that actually health economic analysis, cost implications, ramifications for the system through implication of adoption is actually a routine part and parcel of every single piece of guidance produced. Indeed, when I chair the appraisal panel meetings that prepare the guidance recommendations, and we step through very carefully the evidence to support clinical effectiveness and then cost effectiveness. And without evidence of both in a positive direction, we are unable to support routine adoption. And it's often, if there's a kind of slight discrepancy between one and the other, we have to sometimes sit on a fence and ask for more evidence to be produced. But really, just to answer your question very clearly, economic analysis is part and parcel of what we do in every single guidance recommendation.
Thank you. Really helpful. Thank you.
Thank you both. I think Edwin next, if I may, please.
Yes, thanks. So just to echo it's excellent work that's been done. And I just wanted, I'm Edwin Massey, I'm the Medical Director for the Welsh Blood Service division of the Velindre Trust. I'm deputising for Jazz Abraham today. I just wanted to point out that we didn't highlight the 039 appraisal of electronic blood management systems, which again I think is incredibly pertinent to the trust, in that we are picking up on that. It was groundbreaking work really in terms of international recommendations, having done the health economic analysis, and work is ongoing, which we are very proactively involved in trying to get those electronic blood management systems implemented. The main strength historically has been on the safety level, but you also demonstrated through in an innovative way the fact that it's cost effective, which was excellent. So we will be working on that. So not just the cancer division, but also the Welsh Blood Service division. Very impressed with the work of the HTW.
Well, thank you for those comments. And as you rightly said, I didn't have time to focus on all of the guidance that we produced during last year, but yeah, that was a really interesting project, the electronic blood management system project. And as you say, we do believe that the recommendations and the evidence appraisal review is potentially groundbreaking. Obviously a digital type technology, a technology that is clearly going to reduce, if implemented across Wales, the wastage, blood wastage, and an improvement in cost effectiveness. We estimated from that guidance, you'll recall, that if implemented, there would be the potential for savings across Wales of £1.9 million within the first 2 years of implementation. So a very important piece of work, and it's good to know that that's been pursued, particularly within your own organisation.
And one last question due to time constraints, and it's a very important topic, I know. Steve, please, or one comment.
Yeah, one comment, Peter. Just thank you for the presentation. I mean, we've worked pretty closely together on some of this stuff, and I commend the work that you and Susan and the team do, particularly with engaging, because you don't exist in a bubble. You get out and engage with people, and that's been really important in terms of getting a response. You the slides and the 5-year review, and I'm particularly taken with the amount of time you started to spend with social care over the last 12 months. And I think that's going to be a really important aspect of how you take the service forward in the short term. One last thing, and maybe a little response to me, was the insufficient evidence doesn't just stop there. I think you support people then, if I understand that correctly, try and get the evidence. So it's not a, you haven't got enough evidence, it's how can we engage with you? So it's a very engaging environment, I suppose, is what I'm trying to get across in terms of how we work.
Yes, Steve, thank you for those kind comments, and just two very quick responses. Firstly, you're absolutely right. I didn't really have a chance with the time constraints to talk about an important role that we have in promoting research. I talked about new approaches that we'll adopt to promoting new evaluation and evidence generation across the system. But that is an important part of our function. We work closely with Healthcare Research Wales in presenting them with ideas that have come from our appraisals where more research is needed. I think your comments about social care are very pertinent, and what you'll hear this time next year when I and Susan will be presenting our report for the present financial year will be that actually already within this financial year we have prepared and published 2 pieces of social care guidance to add to the one that we've done previously. So we now have 3 out there on our website, and we're finding this really interesting, challenging work and enormously potentially impactful too.
Thank you for saying that. Unfortunately, I have to draw it to a conclusion there because say we do have a lengthy agenda. But again, just to repeat my earlier comments, thanks and appreciation, obviously the work you undertake in common with all NHS organisations across Wales, very impactful on people of Wales, very important. I know perhaps it's not in mainstream focus, but it's nonetheless very much appreciated. And I'd like to share with thanks of the board to yourself, and please pass that thanks and appreciation on to all of your team. So thank you for joining us today. Thank you.
Thank you very much indeed. And I will indeed pass those kind comments on. Thank you. Bye-bye now.
So to say the report which you've been noting, so I'm just going to check the board is happy to note that report. Okay, thank you. Right, so move us on now to call it a start to the meeting. Just to confirm the process for asking questions or making comments, obviously by raising your hand. If you're in the room, if you're on the virtual connection, then obviously raise your hand electronically. You might not be able to see all of the hands electronically, but Lauren will be monitoring on a separate screen and will pass little bits of paper across to you from time to time, I'm sure, with the people's names on it. So apologies if I miss you online, but we will count here. So firstly, in terms of apologies, we noted already Donna's apologies. I've also had apologies from Steve Allen from Citizens Voice and from Jazz Abraham, the Executive Medical Director. Are there any other apologies that we need to note today? If not, I'll move us on to those in attendance. So I'll welcome, I've seen on screen, I'm sure, Kate Febby. I've seen Kate there. So Kate, welcome from Audit Wales. Thank you for joining us today. Obviously an important part of the meeting. And also Dave Cogan as well, a patient representative. Thank you for joining us today. And then in terms of others who will be in attendance at some point during the meeting, depending on when we get to the items, Steve Wyndham, the Audit Manager for Audit Wales for item 4.1. Emma Rees, the Deputy Head of Internal Audit for the NHS Wales Shared Services Partnership, and Stephen Coxon, Director of Audit and Assurance Services for the NHS Wales Shared Service Partnerships. They'll be attending for item 4.2. Jade Coleman, Quality Safety and Assurance Manager for item 8.1. Zoe Gibson, Interim Head of Quality Safety and Assurance for item 8.2. And Professor Meredith Evans, Consultant Clinical Oncologist, who joins item 9.4. And as already been mentioned, I'd like to welcome Edwin Massey, the Deputy Medical Director, who representing Jazz Abraham in Jazz's absence. Thank you for all of that. Are there any others who will be attending? Nicola, please.
Yes, Hannah Russon will be attending for the Oncology Academy.
Okay, thank you. Moving us on then, are there any declarations of interest? Are there any declarations we wish to declare in regard to any item on the agenda today? Oh, thank you. So moving us on to the agenda itself then. So the first item is the minutes from the Public Trust Board meeting held on the 25th of May 2023. We're asking to confirm the meetings as an accurate and true reflection No, I'll take that then that we agree those as an accurate and true reflection of the proceedings. That then moves us on to item 2.5, which is the action log. So you'll notice that all of the actions on the action log are marked as closed, except for the final one, that is still open, but it's not yet due, I think, until the September board meeting. So I just want to ask if anybody got any comments on any of these items. Those ones, Gareth, please.
Yeah, I was going to comment on the last one, Chair.
Okay, 3.3 one,
Yeah, the 3.3, in that it's to provide a proposal to a future trust board, and then the target date is the 28th of September. But I'm just trying to think, does that tie in with our September cycle? Will we get it for the September board?
Yes,
Yes.
absolutely. That's we're working to that, James.
Are there any other comments or observations or questions on the action? Or are we happy to accept all of the actions marked as closed as closed? Yes, okay, thank you for that. So that then moves us on to matters arising. So I'm just going to check if there are any matters arising from the last meeting which are not covered on today's agenda. Anybody wants to raise? Oh, okay, thank you. So that then moves us on through the agenda to section 3. This section, we're going to be covering off the accountability report in the annual accounts 2022-23, and the number of documents here, they're all very important documents. I'm aware that the first 2 documents, there's 3 documents in fact, have been through the audit committee. And then those are the documents of 3.1, and then the documents of 3.2 have been through the Quality Safety and Performance Committee. So what I intend to do is, before inviting executive colleagues to speak to those papers, first I'm going to turn to Martin Veal, independent member who's chair of the audit committee, just to ask Martin whether you have any comments you'd like to make in respect of the accountability report the annual accounts has considered at the audit committee in terms of scrutiny, assurance, any comments, observations, or even concerns. So I'll start with this.
Okay. Thank you, Chair. There's a little bit of choreography to be done here, because you say there's quite a number of individual reports which make up the totality of the annual report accounts process. You're right that we had an audit committee meeting yesterday, which considered accountability report and the annual financial accounts as well. But bundled in together, we should also talk about item 4 as well, which includes the audit Wales's opinion on the accounts, and indeed the head of internal audit's annual report as well. So 4.1 and 4.2 are part of the totality of the consideration of the accounts, which is a short article. So if I talk about 3.11 first, which is the accountability report, it's a very long and detailed document and hugely prescribed by Welsh Government. The committee beforehand and during picked up some drafting issues, I think it's safe to say, many of which have been already included in the version that's currently in admin control. So my thanks for everyone who's picked those up. There's a couple of other things just for clarity, which we've agreed will be included before publication, and publication is signing date, which is the 31st of July, which is Monday. So a little bit of work to be done between now and then, but nothing that changes the substance of any of the report. So in terms of the accountability report, we were content that the version that's currently in front of us is one which we're very happy to endorse.
Thank you, Martin. Again, thanks and appreciation to the audit committee for letting what would be a detailed scrutinising of these papers. So say thank you for those introductory comments, and I'm going to pass across into Lauren and Matthew Bunce to present the respective elements of these items. So first item is 3.1.1 accountability report 2022-2023. So I'll ask Lauren to take us through that, and then of course we'll have an opportunity for questions and comments as we go. So,
thank you, Chair. So although between myself, Matt and Sarah will be picking up the sections of the accountability report today, work has been done by our fantastic team. So Emma, Tracy and Emma Stevens, Tracy Hughes and Sue Thomas. So clearly wanted to start with that because we are presenting their work over many months to get to this point. So the accountability report is made up of 4 areas: so the corporate governance report, the financial accountability report, the remuneration and staff report, and then the Senedd Cymru accountability and audit report. So I'll summarise some of the points in the corporate governance report, and also just to pick up on Martin's comments, clarify a couple of areas which are being continue to be worked on today and tomorrow before signing on Monday. And then we'll hand over to Matt the financial accountability report, and Sarah will also then address any questions on the remuneration and staff report. So the corporate governance report, as we'll be familiar with, is a overview of the governance framework of the organisation. And unlike the detailed focus on the impact of COVID over the last couple of reports, this report references the reduced impact of the pandemic over the period, but also draws out some of the ways in which we have learned from that experience and our ways of working. So, for instance, the way in which we've been managing industrial action through the command structure, and using the learning that we had of the command structure during COVID for that recent process. Also wanted to highlight in the director's report, so we've had 2 changes during the year. So in April 22, Stephen Harries was appointed as permanent vice chair. And then in February 23, the portfolio for Strategic Transformation Plan and Digital was revised to be executive director role. And both of these changes were following the revised membership for trusts set out in the Health and Social Care Quality and Engagement Wales Act, so the Quality Act. The report also details our responsibilities and our approach in terms of our hosting obligations, and in terms of duty of quality and duty of candour, also highlights how those changes have been incorporated in how we are governing through our hosting responsibilities for both shared services and Health Technology Wales we just discussed. So that's the overview. In terms of the matters picked up by Audit Committee, which are yet to be included. So there are some further detail in the director's report, which there was some repetition in terms of board committee advisory group and membership and attendance. So between Matt and I were just tidying that up today. And then in the information governance disclosure statement, there's Matt's working on reducing the level of detail regarding reportable incidents to the ICO during the period. So that has just been actioned as we speak. And then to confirm that the Director of Shared Services signs his own governance statement, and the Director of Health Technology Wales also signs a governance compliance statement. So we will then receive in the final version the copies of these signed statements as well. The other point, as Lotte said, that audit and data have been included in the version that's been loaded for admin control today.
So just to understand, there are further changes to be made in this document.
So those 2 relating to the director's report and the IG disclosure statement.
So will they need to be reviewed after this meeting by anyone?
That wasn't proposed because it's taken out.
They're
the
routine. We know
detail.
what they're going to say. So we're going to it's just matters back.
So we're able to agree the paper today, subject to those 2.
Yeah.
Amendments of VMS, which we're aware of. Thank you.
Yeah, that's proposed.
Okay, so thank you for that. Any comments or questions at this stage? I say recognising it's been thoroughly scrutinised at Audit Committee. Brings you for approval.
Just going to hand it over to Matt.
Yeah. Okay, so we'll at this point we'll hand it across to Matt now, please.
Yeah. So obviously, as you're aware, the Audit Committee's
detailed scrutiny of the financial accountability report has already happened. So I'll briefly just set out some of the context. So as you know, we've been working in a unprecedented times, really, in terms of the economic climate and the ambiguity around political, social events, volatility that creates in the world in terms of the economy. So all of that has impacted both on Velindre, all the NHS bodies, but obviously the country as a whole. So started the year with COVID still in place, people working from home remotely. We've had supply chain disruption, inflationary impacts as a result of invasion of Russia and Ukraine. A cost of living crisis with inflation running over 10% throughout the year. Mini budget, which also led to further economic unrest and uncertainty, increasing interest rates, and then of course we've had trade union disputes which have been unprecedented. So all that context is important in terms of this financial accountability report. But despite all that, I'm pleased to say that the trust has met 3 financial targets that Welsh Government set for it. And really that's down to the hard work commitment of all the staff in Velindre. So it's not the finance team that get that position, those 3 targets, it's all the staff within Velindre and their dedication in terms of delivering the services in a really difficult condition and situation, but still managed to do that within the financial constraints that are set. So in terms of those 3 targets, you're familiar with those. So the first one is the break-even duty in terms of revenue, living within our income. So we've delivered that with a 76,000 underspend. That's split between us and shared services. As you know, we consolidate that position into ours. We have a duty to prepare our 3-year integrated plan, and that was signed off by the Minister earlier in the year. And we also have a requirement to pay our creditors within a set period of time, 30 days, and we've delivered that target. So those are the sort of financial targets. There are other administrative targets as well, which I won't bore you with, but so I suppose that's all one of the same. It's been a successful year in really, really difficult times, and it's only, well, we know it's not going to get much better in terms of the economic climate, unfortunately. But we've got good plans in place, and we're going to be working hard with our colleagues across Wales, hopefully to help reshape the sustainable finances for NHS Wales. And some of the stuff that was touched on in the Health Technology Wales discussion is an important place for us to go. We do not make enough use of our organisation and others, because they have the key to unlock some of our financial sustainability problems when you start to look at the work they do. And we don't seem to be able to, we need to be using that information in terms of that economic appraisal they do, and not make silly decisions about, oh, we can't invest that cost without understanding the full economic picture of what it means.
I'm sure the board would want to echo your appreciation of all the staff. Will continue with a very high quality, compassionate care in incredibly difficult and unexpected circumstances for many years. And it's a tribute to all the staff that we're able to actually achieve such high levels of quality of care and still manage to break even in such circumstances. So I know the board will want to echo that, and of course also thank the finance team for their hard work for that as well. Martin, please.
Just to echo your comments, Chair, it's worth noting, as I think we did yesterday at the audit committee, that achieving all of these duties is not something that large swathes of NHS in Wales does. And this is not routine. This is not, and it's not done by luck either. It's done by real hard work. So I think we stand in a very, very good place with our finance team. Again, just to echo your comment about we should give thanks to the finance team and the rest of the organisation for stewardship of public money.
Yeah, if I could, just to thank Matt and Chris, because I think for both the audit committee and for the trust board, they provided IM with a briefing note. Extremely helpful, 83 pages to review, but actually those summary briefing notes really helped get to the salient key points that we just want to analyse and obviously provide assurance on. So thanks to
Any more comments, questions, observations on Matt's papers?
Perhaps
Andrew, please.
just again to echo Matt was saying about, investing in the long term. So, if, for example, Health Technology Wales are making a key recommendation, which is, let's say, radiotherapy processes, and there's a cost associated with that, we have to be able to, staff have to be able to step back and look at that longer term view. And then when you kind of feel like you're in crisis, just trying to deliver, there's a real reluctance to change process. And so this is all about engaging with expert, evidence-based information coming through, and research as well, which I'm later about. Yeah, so I think that's an important point to bear in mind. We don't stop investing with a long-term view for improving processes because there might be up for costs. So yeah, endorse everything you said.
Thank you, Andrew. Okay, I don't see any more hands on the finance aspects. I think you mentioned about Lauren and Sarah, you might want to make some comments around the remuneration staff.
Yeah, I don't intend to add anything to what Colin said, but obviously happy to take any comments or questions.
Okay, thank you very much. So these papers are here for approval, obviously to note the content and to approve them. Are there any comments or questions on any of the papers in section 3.1? If not, I will take us through each of them in turn. So we've got the cover paper, then we've got 3.1.1 is the accountability report 2022-23, and the board is being asked to approve that report, noting of course that a few minor amendments of which we are aware, Martin and others have cited on. I'll be happy to approve that accountability. Thank you. Been asked to note the annual accounts for 2020-23, including the letter of representation and the trust response to Audit Wales regarding trust governance and management arrangements. And we're asked to approve the annual accounts for 22-23, so those items 3.1.2, 3.1.3 and 3.1.4. Okay, of course, we do have audit on the agenda in section 4, as Martin has alluded to. So are we happy to note the accounts and to approve the accounts of 22-23? Thank you very much. That concludes item 3.1. I'm going to move on to 3.2 now, which is the annual performance report 22-23. And this has come to us through the Quality, Safety and Performance Committee, which Vicky chairs. So before inviting Carl and Kath to take us through the paper, I'm just going to ask Vicky whether you have any introductory comments you might wish to make in terms of the scrutiny and assurance process, in terms of QSP.
Yes, certainly. I think in the cover paper on page 2 of 6, you can see the governance route that this has gone through internally. There's also explicit national requirements for this report. I think particularly to note, and then I'll pass to Carl, is just positive feedback from Audit Wales on this process and the report itself. So we endorsed it at QSP for board approval, and so here for consideration today. So over to Carl.
Thank you. Well, just again, for clarity, we've got 3.2 is the cover paper, and 3.2.0A is the annual report. Carl, please.
Yeah, thanks, Chair, and thanks, Vicky. So obviously colleagues have had a chance to read the paper. Just 2 or 3 things, and I'll open up and bring Kath in terms of conversation. Context is important, as Matt has already said. Increasing demand, still facing the impact of COVID, cost of living, financial challenges, and just the cost of living as an example in terms of asking people to drive to donate blood and so on and so forth. So that's the sort of context. The second thing I'd just like to say right up front, I guess, is a big thank you to all our staff, our patients, our donors, everybody who's helped us to plan, design, deliver and receive services throughout the year. In terms of turning to the report, I think there's 2 or 3 things I just wanted to highlight. The first is a really important one in that the quality and safety and experience of the service for blood and for cancer remains good, with really high positive feedback from those people who receive the services, notwithstanding the fact that we know and we're actively pursuing the improvements which need to be put in place going forward, and we pick up on some of those a little later. Just draw the board's attention, and I won't go into detail, to page 16 of the report, which captures some of the progress made in terms of the trust performance scorecard. And again, just to draw a couple of themes out, the first again is around safety and infection prevention control, so safe environment, very positive. The second around access and waiting times, those things which are important to patients, particularly, again, remains high. Bit of a dip during the year, but we've managed to get back up. The key question now is how we go forward and sustain that. And I think the point made earlier, not doing the same things the same ways, because that won't be possible. So how do we actually transform to maintain quality, reduce cost, and improve sustainability? The third point really is the experience people have of receiving our services, again, remains high. But again, we would all encourage the board and the organisation not to become complacent, because when people are in need, their active response is to be grateful. So I think we mustn't lose sight of the fact that there are many things we still need to continue to improve upon. And the last matter touched upon is the financial management. So deliver level of quality and performance within the financial arrangements with those challenges, I think is a real credit to the staff. A couple of other points to make really. So that's about the frontline service delivery, but just to draw the board's attention also to the things which support that frontline delivery and also enable the organisation to grow. So throughout the report, you'll see, and I picked a few examples of the workforce. So how do we develop our workforce? So for example, the Trust Inspire Management Programme, so our next set of leaders coming through and supporting us. And how we look after staff through perhaps the Employee Assistance Programme. Secondly, then digital. So there's some good things in there around digital basic services, how we actually put systems in place and provide help, but also some examples there of some of the threats we're trying to actively manage around cyber security, making sure we've got good arrangements in place. And then some of the exciting stuff around robotic process automation and AI and outcome imaging. And the last thing I just wanted to bring to the board's attention really is climate change and sustainability. We had a bit of a conversation yesterday in the audit committee about decarbonisation, so we're making very good progress on that and on target to achieve our 16% reduction by 25 and then the 2030 NHS Wales target, but also the other things which perhaps don't always get the headlines. So biodiversity, you may or may not know, we've now got some beehives over in Llantrisant, and there's a huge amount of excitement and broader social value gain from having people do things which are possibly outside of the normal scope of the NHS, but really get into that sort of social prescribing and really thinking about how we move from an intervention service to a public health prevention service. There's some really good factors in there. And last but not least, some of the other things which we're working very hard to deliver around the major projects and infrastructure. So you'll see in their trail IRS, and Kath will touch on that a little later. You know, we've successfully delivered that project and the first Linux in place, and Kath will touch on it later. Satellite centre in Abergwenny is well advanced in the construction. We're nearly there, I think, on closing the deal on the new cancer centre, and finally, but not least, refurbishment of the blood service of Llantrisant. The board will receive an OBC in the coming months. So that just gives a flavour of perhaps all the things which we, help to support frontline services, which are of high quality for patients and donors. So I've got the easy bit of presenting that part of the report. I'll just hand across to Kath, who's got the hard job of making all this magic happen. So I'll just pass across to Kath.
Well, I think your coverage was so comprehensive, Carl, that I'm not so sure there's an awful lot more really for me to add, other than to pay testament to the hard work and the flexibility of our staff. Because what we've done in some very difficult circumstances is to be able to, in the main, achieve our performance, and where we haven't, to rally through and to plan not only about how we deliver today, but how we deliver tomorrow. So there's considerable change programs that are already in train, as well as delivering that service today. And especially in some areas where we're really challenged with highly specialist staff, where there's professional shortages in recruitment, and working in different ways to make sure that we're able to make the best use of those the considerable experts that we have. And in the face of the cancer centre of increasing complexity of patients coming through, and I know if Jazz was here, then she would be again pointing out the increase in the range of therapies that we have, and the increase in the complexity of some of those therapies as well, and what that actually means for our patients in terms of improved outcomes, but also for us in terms of that wraparound care that we so ably provide. I wanted to also, one other thing I wanted to add to Carl's was also how we've continued to mature the way in which we operationally as well as strategically engage with health boards, and I think that has really continued to flourish and continues to bring further advantage to the way in which we plan and deliver our services. It would be amiss of me not to give a little bit more about the tremendous work that has been done by the team in the radiation service in terms of implementing the first LINAC, although that fell into the go live fell into this financial year. The considerable work that was done to pick up on that signed contract and to get that over the line in breakneck speed. And it wasn't just about plugging the machine; it was everything else that went with it. And we're going to take the opportunity to share some more of that with you at the board meeting in September and bring the team in to do that. I think it would also be amiss of me if I didn't mention the go live of DHCR last November and the enormous change that was for us, and how then through the rest of the year we embedded and had continuous improvement cycles through that in terms of embedding that. And then for WBS, how they sustained their service in quite difficult change both for our donors and change for both the venues that we collect in and continue to respond to that. And also that we were also implementing new equipment and new testing regimes in the context of in context of that period of having to work really hard to maintain our stock levels as well. I think that's all I wanted to really cover. But again, happy to take any other questions or observations anyone as well.
So I think that's us, Stephen. So I think in terms of 22-23, very positive. I also do want to take the opportunity though to end on an optimistic but realistic note coming into this year. We know we have significant challenges around not just sustaining the level of quality, safety, experience, but improving it. So I think we've just got to be pleased with our progress, but I think there's an awful lot more which has challenges during last year and will continue to, particularly around the quality agenda and the duty of candor, the duty of quality, which Nicola's actively championing and leading us on. But there's a lot to do just to maintain without improving. So I would want us to not fully cited on that as a board today, because last year was positive. It wouldn't take an awful lot for us to struggle to maintain some of those levels without even thinking about improvement.
Yeah, I think to add to that, a particular focus for us is around staffing and recruitment and how we address that. So I think in the light of those comments from Carl, I think I'd like to highlight that we're working closely with Sarah and the team and then the team on it as that becomes an increasing issue for us, or for the NHS, and how we're feeling the impact of that on us. But again, further discussions we'll have as we go through the rest of this year and into next year.
Some questions on this. You were slightly ahead.
Thank you, Chair. I was just going to say that this is a hugely impressive document setting out the achievements of all concerned in the last year. However, there's a but coming. The impressiveness of the document is halted to some extent by the fact that a number of typos in it. I think we need to pick those up before we submit this document on Monday. So I'm happy to sit down with whoever is able to go through those, but more than a handful.
Picking up on your offer, rather than try searching the second.
I know we got.
Yes, thank you.
Okay, thank you. Andy, you had hand up?
Yeah, so Kath, just on DHCR, and you talk about the challenge of implementation, and I kind of understand that as a sort of mix of clinical specialists, not digital specialists, and you know, so there's always that when there are new systems and culture changes. How much help do we get from, well, both I'm thinking within Velindra's digital service, but think organisations like DHCW. Sorry, forget these acronyms. So yeah, because to my mind, they have that all Wales oversight. How do we work with them, and are there potential for improvements there, or just get more help?
So not necessarily more help. So the implementation of DHCR for Velindre was a phase within the All Wales Cancer Informatics programme. So Velindre has been part of shaping that, and that was about shaping the replacement for the Canis programme that this provided for us. So the lead for that programme was DHCW in terms of the technical element. They produced the technical solution that we, in partnership with them, both informed the development of and tested it and then implemented it. And I think the one thing I would really like to pay testament to is the way in which the two teams worked together. There's three elements really: DHCW and their technical and their program team, our own internal digital team, and then also our staff on the ground who were and who were implementing it. And it brought all three together. But it's not a task and finish. It was tremendous change. So we've had a tail out of the back of that program that's been looking how it's landed, looking can we tweak it further, looking at what how we continuously improve it, how we supplement and train. So that there's been a whole program around that. But it's been a complete collaboration. But as I said, it is a national program with the oversight by DHCW, and ours was the implementation.
Good to hear. Thank you.
Yourself.
Yeah.
Any others? I just wanted to come, obviously it's a very, very positive report, and rightly so. I picked up in the report, just in terms of the patient experience section of it, which is on page 25. Table there, and we're asking patients to rate their Velindre experience and what percentage scoring, which is sort of in the low to mid 80s typically.
Sorry, I can't get to the table very quickly, but Sarah's got that. Yes.
So obviously it's below target. I mean, we know how hard everybody is working, what an excellent services provided, but we are getting below target on patient experience. So I'm not clear from it. I know this would have been discussed in detail. QSP. I'm not sure whether this is simply a function of perhaps a very small sample of people, or whether it's a few people I feel have not had a very good experience at all, and most people have a good experience. I don't know just whether you think, just to summarise for the board, how this is made up, if you even know.
I don't know the detail, but I know that I don't know if Nicola can help me out here any in relation to that. But I think it just in general terms, I give Nicola a minute to see if she can help me with that. I think there's
25.
It's 316 of the bundle. I think I think there's that feedback, and with the use of the Civica system and the way in which we're managing to look at the granularity of that, we are improving our ability to respond to that. I think, and I think it's about making sure that's integrated into the way in which we manage and service change within the organisation. And I know that that messaging, that feedback is now more firmly embedded. There are obviously some hotspots around the service, as both in terms of how we're operating generally, but also in terms of some of the bedding in of the new digital systems, and some of the challenges of that call for. As you would expect, such a major system change to do, which I think are also probably reflected in there. But I don't know if there's anything. Nick,
if you look for the cancer service, there's two different measures there. That's the recommend. Would you recommend us, which is what something is called the Friends and Family Test, and then the Velindre experience. The Velindre experience ones is based on the national NHS Wales experience survey, which is quite detailed, and there is an overall score in there. And that percentage is the highest category of that. What I will do, the team are coming later to present the annual patient and donor experience report. So I'll ask them to give a specific, what that specifically means when they attend this afternoon. I don't have that information to note, but it's not because 14% are having a bad experience. I think it's a very high threshold. They're asked to score between 1 and 10, and I think it scores at 9 and 10, but I'll clarify that, and we will update the board later on this afternoon.
Yeah, it's important the board understands
yes
what these figures actually mean.
Excellent.
Okay, so any more comments or questions on this paper, which is also Matt?
Well, another valid point. So would we then, once to clarify that, put a bit of an explanation to make sure if a reader reads that, because that's been not war and peace, but a nice little sentence that goes right away. This is the group 9 to 10, and everyone else had a pretty good experience, by the way.
Yeah, you do need to do that.
If that's true, obviously.
Yeah, you need to do that, and we're in the process of refining that measure within the performance framework, and also commencing our always on reporting on our website, and that will be explained through that as well.
But just for this particular report, it's going to go out on whenever.
I would suggest then, if you're happy, the paragraph is drafted, if there's chair of QSP, if you could cast your mind on it.
Certainly.
If you're happy with it,
Yeah,
then you
that
can
would
add
be really
that.
helpful.
What I propose is we approve this performance report, or subject to you
Yeah.
being satisfied on an additional paragraph. If you're happy with
Yeah. Super well.
that. Are we all happy to do that? Okay, so say I know it is discussed in detail in QSP, but it's obviously important that it's aired at the board as well.
Yeah.
So we're therefore happy to approve the annual performance report 2020-23, subject to the addition of a paragraph to be agreed with the chair of QSP before finalisation. And of course, sorry, and the typos. You're going to look to you, Gareth, to lead on that. Right, thank you for that. So that completes all the items in section 3. Now we're going to move on to section 4, which is the audit wins and internal audit report section. Why bring in colleagues from Audit Wales? Welcome, Steve. Nice to see you. Before I come to yourself again, I'm just going to turn to Martin Deal, independent member and chair of audit committee. Last Martin, in terms of 4.1 and 4.2, whether there are any comments you have in relation to the scrutiny insurance process.
Thank you, Chair. Again, we received documents that are in 4.1 and 4.2 here today. We received those yesterday at Audit Committee and endorsed them for approval here today. Taking each in turn, the first document, the Audit Wales ISA 260 report, the headline is that the Trust will receive an unqualified audit opinion, which is excellent news, and it's a very good result. People will remember that last year, all across NHS Wales, there was a technical qualification in respect of the ministerial direction on consultants tax. That has changed partly because of what the General has reflected again on it, and partly because the UK government has announced changes to the tax regime in that area. So we do have a qualified opinion, which is excellent news. The ISA 260 report lists a number of misstatements which are shown as being corrected in the final version of the accounts. It's worth mentioning, because the ISA 260 report doesn't specifically mention it, but I'm sure Steve will talk to it, is that those are categorization errors and not anything which actually affects the bottom line of the account. And I think that's really worth noting, that the numbers in that appendix are large, but they are basically moving things from one part of a note to another part of a note, not changing anything which affects the substance of our accounts. So it's an excellent result. Again, tribute to particularly given some of the staffing issues we've had in our finance team. It's a terrific result to get here for the statutory deadline of 31st of July. So I'll talk about the internal audit later, shall I?
Yes, we'll cover that. Right. Well, we'll do 4.1 first. So thank you for those introductory comments. I'm going to turn now to Steve Wyndham, who's joining us virtually from Audit Wales. Welcome, Steve. So I've invited Martin just to give us some introductory comments. If you could now take us through the paper, please.
Of course, thank you, Chair, and good morning, and good morning to everyone. Martin has provided quite a neat summary, actually, in regard to the key sort of findings and the key content of this report. So I'll take you through it very briefly, and I'll add a bit more flesh to those bones, if I may. But yes, the report. Pardon me.
Yeah, please, we need to hear from you as well.
Yes, that's great. Thank you. But the report did go to Audit Committee yesterday, and we had a good discussion on the report. And it's here today, really, just to support the approval process of the annual accounts. So it's it's appropriate that it is on the agenda. It's appropriate I have the opportunity to speak about it. But Martin's quite right. The key message is it's an unqualified opinion, which we intend to issue on Monday, the 31st of July, and we're on track to do that. That's always been the date we would intend to provide the opinion, and I'm pleased to say we're on track to provide that opinion as planned. The report does refer to a couple of areas that remained incomplete as of yesterday. One of those areas, this paragraph 6 of our report I'm referring to, if anyone's looking at the report. One of those areas is now complete, and that's our review of the revised accounts. So I'm pleased to say that's done. We're working through our file review. That's ongoing, and it is almost complete, and there's nothing to flag or communicate, no late issues arising from that at this stage, but there is still a little bit more to say. I can actually say we've concluded on that piece of work. I say work in terms of a file review. When I say file review as well, I'm talking here about our own internal quality control issues, really, whereby we review the work of our auditors within the team. And the final area then, we're waiting for some final queries just to wrap up some loose ends, really, in many ways, in regard to our IT audit work. That's progressing, and I expect a response to those by the end of this week. So that would then wrap up the audit ready for Monday's certification. In terms of the main findings, again, just to reiterate again, because it is a key point, we do intend to issue an unqualified opinion. Martin has referred to the corrected misstatements, and they've all been corrected. So there's nothing uncorrected that we've identified from our audit that remains uncorrected. All issues have been addressed and resolved within the revised accounts. There have been some amendments to the accounts as a result of our audit, but again, Martin is quite correct in referring to the fact that none of them impact on the bottom line, none impact on the closing position of the trust. They are just classification amendments, narrative amendments, and other forms of disclosure amendments. But they're all summarised at Appendix 3 of the report if anyone wishes to look at those in any more detail. And the final thing I say, this paragraph 16 refers within our report, and this is really just to say really that there have been challenges in completing the audit. Not only have we had to contend with a new audit approach this year as a result of a change in auditing standards, there have been sickness and staffing capacity issues within the trust. But I think it's fair to say, and I'm pleased to say, that we have all collaborated together and we've worked closely together to navigate our way, I think, through this. And so, yeah, I'd like to convey my thanks really to officers for their support, and to Matt and the team to enable us to get to this position. So, as I say, it has been a challenge at times, but pleased to say we're very nearly there. I'll stop there. As I say, it is just a very precise summary of the report, but if there's any questions or comments on the report, I'd be pleased to answer them.
Okay, thank you, Steve. Thank you for taking us through that. And again, Martin, thank you for your introduction. Now, this is used for approval. So are there any comments or questions on the report as presented before we move to approve it? Martin, please.
So the one comment I would make is the one I made yesterday in my introduction, and indeed Steve's repeated it, that the appendix 3, which is in paragraph 14, indeed says that thing about there was a list of corrected misstatements. They have been corrected, and as we both said, that had no impact whatsoever on the bottom line. It would be hugely helpful to a reader if this report said that. And consistently, they don't put that in, and it's kind of rather annoying because the report doesn't necessarily always sit together with the accounts. It sits separately on the website, and a reader might be led to think their accounts have been altered by millions of pounds. Indeed, they haven't. That's my kind of endless frustration. I didn't realize an updated version was going to be put here because there was a mistake in this report that has been edited. So I didn't realize it was being edited. So it would be nice if that had been put in. It hasn't.
You're not wishing to put you on the spot, Rose. You've heard Martin's comments, which were shared with the audit, just around clarifying to the public that the corrections made have no impact on the bottom line. Is that something that Audit Wales would feel it appropriate to include in this report?
Well, the report is now finalised, and given it's been communicated formally to you today, that is the closing position. The one adjustment Martin referred to was done prior to the audit committee meeting yesterday. So it was just, it was done earlier in the week. So it is as it stands, but my response is, I take the comments in, as they're intended. It's a fair point. But if a reader was to review the accounts and our report, it'd be quite evident, I think, from reading Appendix 3 that none of the issues, none of the amendments actually impact on the accounts.
Again, Martin raised the issue at the board.
Helpful if I put it on minutes, it'd be helpful at least so we've got clarification.
Yeah, so if there is a question subsequently raised by the public, we can then refer them to the question being raised at the board and the response from yourself, Steve. So thank you for that clarification.
Sure.
Oh, sorry, Karen.
It'd be helpful to note in the minutes as well that Steve Wyndham did agree that there wasn't a material impact on the bottom line.
Yes, well, so I just need to check with you, Steve. Our understanding is you're agreeing there was no material impact on the bottom line as a result of these corrections.
Well, that is correct, Chair. Yes, that's correct.
So, doing that rather than to see it. Yeah, thank you. Yes, he did. I know, but I just wanted to check. And Vicky, did I see your hand up?
No, I'm just going to point out this.
Okay, thank you. Okay, these important points of clarification, we'll make sure they're captured appropriately in the minutes for the record. Okay, so I say thank you again for that, Steve, and for all the hard work you and the team put into reviewing, auditing the accounts and expressing an opinion. And very pleasing, of course, to get an unqualified opinions as a result of the change of view, not by yourselves, but centrally around the issue that's previously prevented that in terms of consultant. I think it was it pension or tax? Tax, it was, yeah. Thank you for that. So I move that the board now sees and approves the ISA 260 report 2022-23 from Audit Wales. We're happy to do that. Yes, thank you. Seeing nodding heads, thank you. Again, thank you very much, Steve. Thank you. You are, of course, welcome to stay, but I know you already have a representative attending, so you're very welcome to stay. Thank you so much. Thank you. That now moves us on to item 4.2, and I can see Simon on my screen, Simon Cookson, and I think we may be expecting Emma Rees as well. She's there. Hello, Emma. Hello, Simon. Before we ask you to take us through the report, I'm again going to turn to Martin as Chair of Audit Committee, just to ask Martin whether there are any introductory comments you wish to make as Chair of Audit Committee.
Thank you, Chair. Yeah, again, this report was received yesterday at Audit Committee, and the thunder of this report is stolen somewhat by the fact that large chunks of it have been already replicated in the accountability report we've already approved. The headline is there in paragraph 1.2, page 3, which says overall reasonable assurance opinion, which is a comfortable, sorry, I shouldn't say that, I'll leave that for Simon to say, but an above the line assurance rating that we can take reasonable assurance arrangements for governance, risk management, internal controls are suitably designed and applied effectively. In other words, that is a good result. I mean, there is the possibility of a higher opinion than that, the substantial assurance opinion about something they are given out likely. And then on the next page, you can see the range of audit reports that have been signed off, again with a large majority in the substantial and reasonable category. That's all I want to say, really. It's that those headline facts have been replicated in the accountability report that Simon talked about.
Okay, thank you, Martin. So Simon, Emma, welcome. As you've heard, Martin has given us an introduction as Chair of the Audit Committee, just to assure us around the scrutiny process to date, and now very much a matter of hearing from yourself on the paper as presented.
Well, thank you, Chair, and good morning all. This will be a very brief summary indeed, because I think Martin has covered the main points. This was discussed and noted and received at the Audit Committee yesterday. It is a positive reasonable assurance report based on 3 substantial, 10 reasonable, just the 1 limited assurance report, and 3 other pieces of advisory support. And you'll also see in section 3 that, as in previous years, we report the results of national audits, those done at NWSSP and now DHCW, that have an impact on our forming an opinion, and those were all positive outcomes in terms of the year. And as Martin says, a number of elements of the report have been lifted for the accountability report correctly. So I think just the two other points really to make. Clearly, as the Cancer Centre develops, we have a programme of work around that. It's quite right that it's fluid. recognising the change in timelines and so on. So that is reflected in the report, and we have deferred a number of pieces into 23-24 to form part of that year, this year's plan going forward, and I think that's absolutely fine. And really, that's all I want to say in terms of the report, other than to thank the board and its members and officers across the trust for the support we've had during the course of the year. That's it, Chair. Happy to take any questions or comments.
Thank you, Simon. So are there any more comments or questions on this particular report? Seeing any hands? No, thank you very much. So the Shared Services Audit and Assurance Services, the Head of Internal Audit Opinion and Annual Report 2022-23, and we've been asked to note the content of the 22-23 opinion. Happy to note that. Okay, thank you very much. Okay, again, thank you, Simon, and again, thank you, Emma. And say, as always, you're welcome to stay if you so wish, but if you have a busy day, as I'm sure you will, then thank you again for attending.
Thank you, Chair. Thank you all.
Right, I'm going to move us on to section 5, which is the key reports, after which we'll be taking the plan break. So we've got 4 reports to take us through. The first of those is the Chair's report 5.1. So obviously Donna's not here to present that report, so I will briefly take us through it, trying to, I suppose, second guess what Donna would have highlighted. And it's difficult to pick things out of the report when everything in the report is very important. But I will just highlight Donna's attendance at the Welsh Blood Service Donors Awards in Llandrindod North Wales back in May 2023. These were very regular and very important occasions, which, of course, the pandemic sadly put a stop to. But these were the first ceremonies to take place subsequent to the pandemic, and Donna attended both of those and presented at the awards to our donors. Several matters there regarding armed forces and veterans, which you can see for yourself. Just the note there about the National Service Thanksgiving to celebrate the 75th anniversary of the NHS in Wales. We will separately be touching on the tripartite agreement between the Trust, the University of Wales and the University of Wales St David in another agenda item. I must of course highlight the RCN Nurse of the Year Awards. I don't know, Nicola, in Donna's absence, I don't want to put you on the spot, and if there's any just brief comment you want to make about those awards.
No, just to say how fantastic it was to celebrate the amazing nurses across Wales. We sponsored this year, as we have done many years previously, the overall Nurse of the Year, and it was Tara Rees from Cardiff and Vale who won that. And we did give an opportunity for our previous category winner, Diane Rees, who won the Healthcare Support Worker of the Year award during the pandemic, where the actual ceremony could not take place. So it was fantastic for Diane to join us for the movement.
Thank you, Nicola. Thank you. Then last couple of items. Chair had her annual appraisal with the Minister, the Health Minister, on 7th July 2023, and once received, may have been received, I don't know, the Minister's feedback letter will be circulated to the board. And then lastly, just to, on behalf of the Chair, extend congratulations to Neil Frow, the Managing Director of the Shared Services Partnership, for receiving the award of an OBE in King's First Honours List. So I'll just take us through there very quickly. Are there any comments or questions on the Chair's?
Only quickly to add on the Blood Service Donor Awards. So there's been another one, because I was asked to go in Donna's place in Cabral, and again it was very successful. But it does remind us that there's an awful lot of these to catch up on. It didn't happen for 3 years or something. And so I'm sure that Donna will be looking for, Donna can't go to them all, and there's a whole bunch of them planned before and after Christmas, and I'm sure that Donna will be looking for people to go along and represent and get out towards and say a few words.
Which is exactly how it worked pre-COVID. We were all invited to be involved.
It's just there's as I say, the backlog.
that's important. So are we happy to note the content of his report? If so, and this on the Vice Chair's report, which is my report. First time in some time, actually, we've given the Vice Chair's report. We did used to be one stage going back some years. I'm not going to take you through it because I'm going to assume people have had an opportunity to read it, but I'm happy to take any questions or comments if there are any. If not, it's you for noting. Okay, thank you very much. Then 5.3 is the Chief Executive's report. So Steve, I'm just turn to you, and this is you for noting.
Yeah, just I think the first items speak for themselves, so I'll go back through those. So I just pick up in particular the appointment and arrival of the new Trust Head of Innovation, and it's arrived on the 30th of June, so she's in week 4. She's gone through an induction of more really important posts for us that we will begin engaging with, and we had a bit of a gap. I think that should be good asset to the trust, and she will start taking that agenda forward and coordinating the work that we all do, and actually helping and supporting people to drive through innovation. So I think she'll be a really good addition to the team, and no doubt, as I promised her yesterday, she'd be invited to one of these board development sessions from the Strategic Development Committee over time as well. And no doubt, Andrew, you will see at the RD&I committee as well.
Yes, we did recently. Yeah, that's there.
So that's a great addition to development resources.
Any comments or questions on the Chief Executive's report, Lauren, please?
I was just going to follow up on Jeanette because Jazz and I know her well because she's been with government, so it's the CV summarised there, but most recently she's been government lead on university status for NHS organisations. So when we've been working on the various ad hoc events and our review processes, she's been absolutely brilliant in providing guidance and connections and that whole framework. So just follow up on what Steve said, really, in welcoming her, and I'm sure she'll be a regular attendee at sport development in particular, because that's the most effective.
Thank you, Laura. Any more comments or questions? The report is used for noting. Any comments or questions on this on to 5.4? So this is the Research and Innovation Board Champion report. That's yourself, Andrew. You're our Research and Innovation Champion, and as is customary, internal champion brings a report forward. So on this occasion, it's your opportunity.
Thank you. I tried to give a brief overview. So every health board and trust within NHS Wales has a research board champion that is now being coordinated as a sort of peer group with regular online meetings through Health and Care Research Wales, chaired by Kieran Walsh. And that's very useful then, of course, for us to compare notes with other research board champions. What I've tried to do here is outline the research benefits in the sense of the board champion role is about getting research high on the agenda within health boards and trusts. And so there's a lot of evidence out there, and I've tried to point to some of it here as to why research should run through the organisation in terms of patient outcomes, but also in terms of staff as well, and staff skill levels and recruitment and retention. So there are all sorts of benefits of research that I've just tried to highlight. I put in a few selected examples of some of the significant achievements, and then some of the items that are looming large on the agenda right now, such as the tripartite agreement with Cardiff and Vale and Cardiff University, and the establishment at UHW of a facility, a research hub for early phase and advanced therapy trials, and that's a big piece of work that clearly is challenging because it involves 3 big organisations, but it's really starting to gain some traction. And that's one example of some of the things that are going on. And the rest of it is a sort of some broad statements about how we organise research. By research, I mean research, development, innovation. It's the whole thing. So, but yeah, happy to take any questions or comments on that.
Thank you, Andrew. Any comments or questions? Always very exciting, isn't it, RDNA?
Oh yeah, tremendously exciting. Always.
It is, yeah. Okay, I'm not seeing any more hands. So thank you for that, Andrew. So that's there for us to note as well. Now, I've reached the point in the agenda where it's marked as a break, but I feel I'm failing as a chair because I'm 15 minutes ahead of schedule here. Well, am I allowed to break at this point?
Yeah.
I'm not sure whether this is the time is.
No.
Okay, so this is the on the agenda where we take a 10-minute break. So it's 11:36. So we'll convene just after 11, or reconvene 11:45, please. Thank you. We're ready to restart the meeting. Creating some documents a moment.
Oh, sorry.
That's what sorry, Stephen, I didn't know you were waiting.
Yes, I'll have
Okay.
I can't carry on because you're doing the next item. So. Otherwise, I will. Yeah. Anyway, welcome back, everybody. The trust board. So we now have items in section 6 on the agenda, which is the quality, safety, and performance headings. And the first one we've got is 6.1, which is the this reg, so it's going to be led by myself. I'm going to take us through this, and obviously questions and comments, and then we'll make note of various matters.
Thank you. So the first thing I'm going to say is going to be repetitive, I think, for everyone around the table pretty much, because we've had this conversation in Executive Management Board and in Quality, Safety and Performance Committee and then in Audit Committee. So, but to make sure for completeness, we're clear on what's changed in the assurance level. So previously, since the risk register has been on the new board template, which has been 4 months now, the assurance level has been rated as a level 1. And the recommendation from Executive Management Board that's been carried through for the July cycle is that's moved from a 1 to a 2 due to the improvements made on the quality of the action plans. What is stopping it from moving from a 2 to a 3 is the length of time that a number of the risks, or the majority now that are reported at board level, have been open for a significant amount of time, into hundreds of days in some cases, and those scores have not moved during that time in a number of cases. So that clearly means the root cause is not being addressed, and that's the focus of this current cycle of work, so that we can evidence that through the actions addressing root cause, there is a path to reduce the risk to target level. I'll come back to the audit committee discussion on that yesterday. Secondly, in terms of the discussion at QSP, so the report outlines the deep dive on risks that we had in QSP, which is now going to be a regular item with more information provided going forwards on the risks for the deep dive. And in audit committee yesterday, Vicky pointed out that although the summary from QSP on the deep dives is referenced in the cover paper, what isn't referenced is the discussion that we had actually during the risk item, but also then at the end of Quality Safety and Performance Committee, in terms of the triangulation of risk themes around digital, BI and workforce. Just note that. Thirdly, in the Audit Committee discussion yesterday, when we were discussing the risk assurance level in the move from 2 to 3, the Audit Committee suggested having a target risk score date and also a path to achieve that. So we'll work with from my team with all the risk owners to plot that out in for the next reporting cycle, certainly for these risks that are at board level, and then we can work how we phase that through. The final thing to note from Audit Committee is that there was one risk, it hadn't been published on the website, which was a private TCS risk. So that's been removed from this version. So when there's something on admin control, it was just removing that risk. That was the only change. So there are all the comments on the risk register. The final piece I just wanted to reference, and again, it was a conversation in Quality, Safety and Performance Committee and in Audit Committee, is on the trust assurance framework. So the last time as a board, the trust assurance framework was discussed was in the May Strategic Development Committee, where the refresh of the risks was reviewed, and we were aiming to have that work completed by July. We have unfortunately missed that, so we are completing the work for the September cycle. It's been going fine. It's just one more meeting that we have to do with the Velindre Cancer Services, and then going back around that at Executive Management Board to finally agree the need for the risk owners to complete the refresh risks on the new template. So, so that work will be completed by September, but unfortunately it has meant that the TAF has not been presented at this meeting, which it should be. Thank you.
Okay, thank you. Comments or questions on this paper, please? Vicky, please.
I think just welcome the use of the assurance in this paper, because I think the analysis and the narrative, although it takes a bit of getting used to for the levels of assurance, is really helpful because it helps define how we're going to get to the next stage in terms of development. So welcome that. I think particularly the picture of the digital select, because I think in QSP, the impact of the range of digital issues on the clinical resource is very clear. And so, you know, that as a cumulative risk needs to be understood. So QSP has been having that discussion. And I think the development in terms of achieving a target level and dates for that will help the risk owners to really think about, are the actions that they've put down to mitigate the risks the right ones? Because again, that will drive the level of assurance. So I think all of it is educational in part for people who are the risk owners. But I think as a board, we can then be assured because we'll see the movement, or we can ask the questions about the actions that were taken and why they weren't effective. So it helps complete the circle in terms of our governance of this. So very helpful.
Thank you. Any comments or questions? I've just got one myself, which is at the end of section 4.4, which is around compliance with the introduction of risk training. I know this was discussed elsewhere. Guessing from smiles on colleagues' faces, so I come at this with all innocence. Obviously, it's a very low rate of compliance. So I absolutely understand that this would be not because people don't think it's important, but because, as we've already described elsewhere, everybody's so incredibly busy. It's actually a challenge to free up time when we take training. So my question is, we've set a 6-month target to get everybody up to, well, to get up to as close as we can. How realistic do we think that's going to be?
Very. So we're ahead of schedule.
Okay.
Because so for all new training, 6 months is standard for mandatory training for new modules that are being introduced. So it was introduced at the end of April. So within 2 months, we're already up to near 55. we've got until the end of November to reach 80, which we're confident we will do. We've got the breakdown that we're sharing through our risk group that meets on a now fortnightly basis. And so for each of the breakdown in the table there, those risk leads have got the further breakdown for each of the parts of the group to follow up with organisation.
So again, this may ignorance, is the compliance rate target 100%, or is it that not all staff need to be necessarily trained?
So I'm saying it is 80, 85, whatever it is. It's usually 85.
Okay. So you start something, Gareth, please.
Without wishing to labour this too much, I know we did.
You did, I'm guessing you
about
did.
on the committee yesterday, but I suppose the striking thing for me is that corporate, which one would have expected it had been the one that would have been highest in its achievement rate. I'm not looking at any faces around the table, but
I was going to say, I've got all of your.
and it was always one, which is not a good advertisement for leadership for the other divisions.
Yeah. No, fair.
Just to echo your point, Chair, absolutely. Your question was exactly the same one I asked yesterday, and Lauren gave us those reassurances. We'll never get 100%, of course, because of staff turnover, etc. And I'm pleased that we get to 80%. There's another quality about whether the online module is perfect, but it's a good start, I guess. And we can move down the maturity model, I suppose, once we get people through this model. Thank you.
You may have spotted in my report, I have actually taken this training. Lauren.
I just follow up on Martin's point. If there is, if people have feedback as we're completing it, or any of our teams mention it, would really welcome letting us know when you do it, because otherwise we'll kind of lose it in the moment, and we will have an opportunity then to refresh this.
Yeah.
It did take a while to put that first version together, but in terms of iterations, and there's bound to be things that we want to update for next year, etc. So we'd welcome that.
Thank you. If there's no more questions or comments, we've been asked to note the risks level 2016 and 15, as well as risks in the safety domain of the risk level 12 reported in the Trust Risk Register and highlighting this paper. And we've been asked to note the ongoing developments of the Trust's risk framework, which Lauren has described. Are we happy to do that? Yes, thank you. And that gets us on to 6.2, which is the Performance Management Framework document, May 2023. Carl, you easy on this?
Yeah, so I'll just open up, Steve, thank you. Just a couple of points on process, first of all. So obviously this report continues to evolve, as does our approach. And I think what you'll see within the report now is the start of the sort of golden thread between what the organisational needs to do as an organisation of itself. So, for example, quality, diversity, Welsh language, sustainability, how that then features in the service delivery aspects, so Welsh blood cancer services, how we're getting on there, and then lastly, how our support services enable those things to happen. So you'll see there in the state's digital workforce. The second thing I'd probably say is that I know we've got a board development session coming up on the horizon, because I would probably suggest there's too many measures in there for the board to be considering, but it's useful to have a look at them in this first instance. If you recall, we are trying to get that sort of, what are the 15 or 20 measures the board needs to focus on as you go down that sort of base. So it's worth just thinking about how we make sure the board's focuses on the things which matter the most. Just before I offer up to Catherine, what you'll also see in the report is what I sort of trails at the back end of performance in 22-23 going into 23-24. But by and large, we still provide good, high quality, safe services, good experience. But as you can see, there are some emerging challenges which we expected to see. So what I'm going to do is pass across to Catherine for the operational services. But you'll also see in there now there's a feature from myself, Matt, Sarah, and others who are also responsible for the enabling services, which support frontline delivery. We can each comment on that and then take questions as a team. So I'll just pass across to Catherine first instance, Chair, for frontline service delivery.
So thanks, Carl. I'm going to put a couple of things I think to highlight, and then see if there's any questions that anybody has got to answer. I think Carl has appropriately trailed, as I think we did a little earlier on, some of the challenges that we are seeing within the service. And you'll note particularly in here that we are under pressure in terms of our SAT delivery against target. But just to provide you an assurance about the amount of work that's underpinning, really understanding exactly where some of those the reasons that that are there, and actually what we're doing about them. One of the things that we've identified is the PIC lines. We've had an increase of 20%, which is not inconsequential, and that some immediate action has been taken to extend the services that we're providing, but also to look at how we can bring some of the outside in. And I think we've got a bit. I think it's Cardiff and Vale are coming in to do a sort of sharing of information and ideas with us to help us look at how we can further streamline that service. So immediately, just trying to get extra ideas from outside. We also have service improvement deployed within there. We're looking at three things really. One is the systems and processes and how we fine tune those and have efficiencies, and we stop some of the the noise around the system in that. But also looking at our capacity in terms of the flexible use of our staff, and looking at the ways in which we support that service as a whole from elsewhere across the service. So a real team effort in that, and there is a working group that's looking at that. Actually, and I think before I dive into that, I should probably have really gone back to the beginning and highlighted the positive range of metrics and what we're the performance that we are managing to achieve again and continuing quite difficult times. That was all I wanted particularly to flag for BCC, but I will pause there and see if there's anybody who's got any questions or anything in particular before I move on to WBS. Nick.
Nick first, please.
I just wanted board members to be aware, I just note on page 13 there's to be arranged detailed alongside the hand hygiene compliance standard. We have worked up data definitions, numerator, denominator and data source with the performance team, and that will be included in future reports. Just bringing now as I'm talking, the integrated quality and safety group as part of our duty quality requirements have been working avidly with support of the BI team to really determine what the proposed quality measures are for the organisation, and we received an update this week on how well advanced that work is, and we're hoping to be in a position before the end of the summer to have a priority plan in respect of the addition of some further quality measures that will work its way through the system.
Thank you, Nick. Gareth, please.
Thank you, Chair. It's a very positive report in terms of performance generally, but I guess part of our role to focus in on the ones where the performance levels aren't being achieved. And specifically on page 50, the percentage of outpatients seen within 30 minutes of scheduled time. It says that it's paused there, and obviously we're not achieving the performance levels. So it'd be helpful to have some more narrative around that, please.
So I can update you. I mean, obviously that's been a position we've been in for some time, and we discussed it previously and acknowledged. So that data was collected manually by an intervention of somebody literally blocking patients coming in and out, and that manual collection of data. So the team have been working and are bringing forward as part of the quality piece other metrics that will enable us to measure the patient experience, the feedback and outcome. Instead of that target, we will be bringing that forward in the next couple of months. So that's why that had been paused.
Yeah, well, what's the timeline for that then, please?
I have to come back to you on that because I know the work has been done, but I have to check back with the team exactly what where that is in the process and where it fits in terms of some of the quality work we're doing in the revision of the PMF. I'll let you know, give you an update on that outside the meeting if I can.
Yes, thank you, because I think that's been the case for a little while, hasn't it?
Yes.
Stand the reason, but we need to fix it.
Indeed, long memories will know it's a matter of at least many times over 7 years. I know work is being done on people. I know there's also the complexity of people waiting for bloods and then waiting for their appointment with a consultant, and that sort of makes it even more challenging to get some sort of meaningful measures. So,
that's fine, I will provide you that.
I think I just wanted to pick up on the exec summary, Kath, where you've used the levels of assurance, which is great. But I would have to challenge the level 6, so that realises outcomes are realised in full.
Yeah.
And I think it's always very difficult in the performance report with so many different areas to succinctly do that. But I think this is where your summary, because you say that there's executive oversight in each of the sections, it would be easier to put your level of assurance in each of those sections, because at the moment, where there's areas of concern and there's the length of time to achieve the outcomes, you wouldn't say a level 6. To say the level 6 for an overall report like this becomes very difficult. So I think when it's difficult like that, you have to break it down into the key areas, not each element, but the key areas of performance. So I think I'm happy to work with you to support that, but I think I would have to challenge the level 6 outcomes realised in full, which is set out in the exec summary.
I'd love to be part of that, because one of the debates we've been having is exactly that. So this essentially covers nearly everything we do, doesn't it? So how would you get a composite view of? So I think I would love to be part of that consensus. That would be good. Because I mean, some things might be 6, some things might be 0. How do we get that sense of?
And it depends on the action plan that's in place.
Exactly. Yes. Understand. It's pretty.
Yeah.
Yeah. Okay. Thanks. Perhaps the 3 of us could do that together.
So we've dealt with your question, Gareth, and my observation.
Sorry, WBS, and I've turned over the page to right. Every minute back. So for WBS, I think there's just a couple of things to highlight. And again, in strong performance, I think that it's two things to highlight were platelet wastage. It's an ongoing challenge for us as we have flexibility in demand and short shelf life products and bank holidays and everything. And there's been a considerable amount of work going on that. So I just think we do need to note that. And also that the Welsh Bone Marrow Donor Registry has continued to see some challenges in terms of our donor recruitment and also our sort of bouncing back after COVID. And we're seeing small increases in the number of donations that we're taking, but that we are really starting to now see some green shoots of recovery. So I just wanted to highlight that in particular. Again, happy to take any other questions anybody has on that before handing back to Carl, see if there's anything from colleagues.
Not seeing any hands. Anything further you want to add at this point, Carl?
I just we want to touch on workforce. There's a couple of other points there on 2, 3, 2, 4. Should we just have a quick look at maybe those 3 areas, even if we've got time?
Absolutely. So the 3 key indicators, as colleagues are used to, are reflected here on page 472 of the bundle, according to my bundle. So you can see that we're actually performing very well in terms of the core skills and training framework, as 87% in month, as reflected here. And similarly for PADR, so just to commend staff really on maintaining those levels. We're not meeting the target for PADRs across the whole organisation, which is rolled up in this figure, but clearly we are within certain areas and we're continuing to work with colleagues on that. But just talking about absence levels, so this, the number in here is reflected the rolling absence to the year ending in May, but I can just bring some slightly more up-to-date information on that. So as of the 20th of July, which is the most up-to-date figure we've got, we're now reporting at 5.64%. So we're actually seeing that number tracking down now month on month. And I actually went back and had a look at July last year, so July 22, the year to that date, we were tracking 6.54%. So we actually are seeing that now coming down each month, and we're not seeing any blips in that number. So our dashboards internally are reflecting that positive movement, which is really good news for us, I think, because we were and are concerned, of course, that is far higher than we would like it, but actually we're seeing a positive movement. I just wanted to make colleagues aware of that. And in terms of the in-month figure, when we got the split of long-term and short-term, we sometimes look at the in-month figure. The in-month figure for June shows that long-term is 2.91%, short-term 1.53%, because the in-month figure was 4.44 for June. So actually that's split again. We're seeing a decrease in the long-term. The short term isn't moving, but that's where we're seeing this overall impact bringing the numbers down is in the number of long-term absences, which again is a positive message, which reflects the sort of approach we're taking around very closely working with managers, using the flexibilities within the managing attendance of work policy, which allows us to actually work with people as individuals rather than sort of follow through slavishly to a process. And again, then reflecting the work I talked about previously in terms of minimising employee harm, and that's starting to factor in to the behaviour work, the cultural work that we're doing to positively impact. So I'll leave it at that, but happy to take any questions.
Thank you. Martin, I think you were first, and then I'll.
Thank you, Sarah. That's really encouraging news. And I just want to ask a little bit about the target, the 3.54%. That's a pretty low target. Refresh my memory where that comes from. Is that Welsh Government mandated?
Yes, absolutely. So as we discussed last time, hence the open action on the action log, Martin, you're absolutely right. That's a Welsh Government target, which through conversations with Welsh Government, they are going to review, but haven't done so as yet. Been a bit busy doing other things in the workforce space. But what we agreed to do is look internally and say, well, can we have conversations with our Healthy and Engaged Steering Group, which has happened, with our champion colleagues to actually say, what can we do to reflect internally would be a better measure for us to measure against. So that conversation is going on now, and we will come back with a proposal through the September government cycle.
Thank you. And not to be complacent at all, but 5.4, I think, is the current figure.
3.54.
Yeah, no, sorry.
Oh, sorry. Yes,
is a pretty good position if you look across the Welsh public sector as a whole. I've seen numbers far in excess of that in other places. So not to be complacent, but it is a very good result given the stresses and strains that our staff are.
Yes, absolutely. But what I always reflect on is the pre-pandemic, we were actually always at the bottom of the we were at the top of the performance league, bottom of the numbers, if you like, as reflected in smaller organisations. We would always expect to be actually tracking below health boards, for example, and we're sort of in the pack at the moment, and that feels a little bit uncomfortable to me in terms of what we should be expecting to see. So clearly we've got a lot more work to do to bring that number down, but working very, very closely with colleagues across the organisation.
Brilliant. Thank you, Sarah.
Thank you, Sir. Before we begin, just I guess you will.
Yeah, just linking it in with, of course, we did get staff surveys later this year.
Yes.
We'll bring something back on that later on. We had discussion with chief executives this week about that, and I think that's going to be an important reflection to us about whether staff feel about being here. And I think it's about the environment we create, which will also help with this. And I think certainly a big focus on that. And I think they come together to go on the supportive stuff, and the environment that we actually expect people operating in is going to be really important as well.
Yeah, and if I may, to ask you, as colleagues will recall, we were at QSP when we discussed the risk 3001, where what we've really recognised is that we've got all of the interventions you'd expect to have in place for people across a whole range of wellbeing measures. But we do recognise that one of the biggest impact is the systemic elements within the organisation and outside of the organisation, of course, that are impacting people's well-being. So it's recognising that and changing the focus a little bit, not taking away any of those standard wellbeing interventions, but how can we build on that so that we start to get to the heart of the things that sit underneath some of these other factors.
See, also on that point, as well-being champion, whatever, really discussed it. Some improvement will be bringing. Andrew brought a report on his RD&I champion activities. We've already discussed later in the cycle of business as we bring in well-being.
Absolutely.
Keep simple time. Thank you. Andrew.
That was exactly the same question as Martin. Great minds think alike. So it's been dealt with about absence levels and targets and so on. All good.
Gareth, please.
Thank you, Chair. This is not directly related to performance, but it seems a convenient place to raise it regarding workforce. And apologies if this was discussed at the last TCS scrutiny meeting, which I missed. But there's a long-trailed program tranche report, I think, which is meant to be looking at workforce and where we need people and the pressures on the organisation. And I just wondered if you could have an update on where we are on that and when that is going to be coming through.
Yeah. Well, you go first.
Someone doesn't want to go.
I'm happy to catch it. Though catching is not usually my best thing. So we have started, we've been undertaking an exercise with Workforce and OD colleagues to go through all of the major areas of work, all of the transformation programmes, and to scope out exactly what are each of the individual workforce requirements within each of those programmes, which have been encompassed within the programmes, and also to look then at how they align with all of the other pieces of work that were going on. So we're looking at the individual, in a sort of matrix approach. Meetings have been held with workforce colleagues to start to identify all of those things. We're putting together the themes and we're putting together that matrix piece of work. And that will come to you now over the next. Well, I'm not going to put a time frame on it because Sarah and I have got. Oh, sorry.
Well, I was going to say the time frame that's within scrutiny was October.
Right.
Okay. Executive management report in September, we said, and then into
right. Okay, that's fine. I was just going to say because I just need to check with Sarah. So yeah, so that work is underway.
When does it come? Will it come to board after TCS scrutiny?
We haven't discussed that actually, but we can do it. We'll find it helpful then. Yeah.
Because it's been identified as one of the big risks.
Yeah, no, true.
It's just organisation wide, it's not TCS.
No.
That makes sense. We just haven't discussed it. We've been on the board for November.
There's other things, Nick, as well, Andrew, aside from the one you mentioned, which my team is actively refreshing now, so you get up-to-date position in that sort of September, October cycle.
Yeah.
On the range of the recommendations, not just the resource one, as you've mentioned this morning.
Okay, so for that to be completed, to be on the board for November is the plan.
Yeah, that would be the next board
meeting. Nicola, please.
Yeah, I mean, the other piece of work to factor into that is what the workforce transformation requirements are aligned with the new national extended advanced and consultant practice framework, multi-professional framework that's launched on the 9th of June. So we have started, and through both the Professional Nursing Forum and the Allied Health Professions and Healthcare Science Forum, we have been considering that report, and the heads of service really are looking at what does that mean and what are the opportunities that affords around how the workforce could be redesigned. And I know there's been discussions down to SST, site-specific team level as well, to really transform workforce. It would be a long-term plan to fully enact that, but that does feature into that as well.
Yeah, so just two more points from me, Stephen. So just to highlight, I think something we need to the board more often. So 463, again, we talked about sustainability, but carbon emissions. So we're on track and the carbon is reducing, which is good, as I described earlier. Also, waste recycling is really starting to take hold, and we're doing going further farther and faster. And energy consumption. And then the other bits around page 463, just health and safety, clearly an important matter for the board. No real reportable incidents. But there's still some work to do, as we know, on general statutory mandatory training, albeit it's improved. So further, and then sustain is always the challenge for us. But just worth noting at the board.
Martin, please.
Can I just, there's an example there on that grade table we just took out on page 22463. It says the measurement is paused, yet we've got a tick. And I think that there's a couple of examples in the workforce section where the targets are yet to be agreed, yet we've got a tick. And I think it might be slightly disingenuous to say everything in the garden rosy, it should be blank, or it certainly shouldn't be green tick, it should be blank. We can't say one way or the other, can we?
I think it's just an error, Martin, you're right. So just on those measures as an example, we'll take the tick out because there's a 2BA, whatever. That's the other piece of work. So Nick's mentioned the quality metrics, but if you just take the diversity workforce, we're also working with Sarah just to understand what the national measures are. And then we'll bring that through the board, because that's back to my earlier point around the statutory organisation's responsibilities to represent, for example, the community it serves. So we're actively working on those measures as well. The board is taking all immediate and long-term requirements. We'll bring those back in the next couple of months. But I'll take the tick out, just the important action for now.
Thank you.
Thank you, Martin. I'm guessing there's a folder in each of these cells which only allows for the tick or across. And then that's probably what it is.
It's like it, yeah.
There's some other ones in there I noticed, and again, so for example, reporting of incidents. Well, actually, reporting of incidents is a good thing. We want them reported, so we've got that as a cross. So there's a couple of little anomalies in there which we'll go away and redo. Thank you for noting that.
Thank you, Martin. All right. Is there any more to be said on the performance management framework as just presented before we get to Martin and financial policy? Anything else? Change of 6.1 can you get Mark to it until I get 6.3? That's correct. I think a few things 6.2. No,
It's part of that.
Yeah.
Right,
Yeah.
separately, no.
okay. Well, actually, what I'll then do is I'll now come to you, Martin, and we'll take the orders complete funds. We've got the finance report, May 23, which you're going to present us, I'm sure, for noting. So I'll pass to yourself, Matt.
Thanks, Chair. So obviously, as you know, it would have been through EMB and QSB committee who would have given it a thorough review and assurance in terms of content. I suppose good performance again up to May 23 in terms of our three key performance indicators, which you will be familiar with in terms of break even, in terms of revenue, capital expenditure within our control limit, and meeting our payment compliance with non-NHS bodies. So in terms of our savings target and delivery around that, so we're on track to deliver, although there are still, I would say, a significant proportion of those savings that are still amber, which is my main area of concern, which I have discussed in individual performance reviews that we have with each of the divisions. So it's an area of focus for my head of business partnering and each of the SLTs in the two divisions, because we need to turn those amber schemes to green or implement within the next 2 months. All that is fine, and we've actually got the month free, so the June position. So obviously the cycle is always not aligned, but we are on the same track in terms of the three targets and meeting those by the end of the year. I've said all that, so it looks great for Velindre. We don't work in splendid isolation. We sit in the context of an NHS system that is in severe financial challenge. So urgent meeting was called by the Minister with chief execs and chairs across Wales, and there was discussion around the overall financial system. As you know from last year, health boards were all in deficits, and for the first 2 months of this year, there was a forecast 650 million deficit across Wales. Within health boards, on the month free figures, that has worsened. So there is a heightened anxiety around the NHS financial position, that specific action is being looked at in terms of how we work together as a system to back that position from a revised 850 million forecast deficit to almost 650 million at the minimum. Now, we're part of that system, and so there will be an expectation for us to support, obviously, our health board colleagues in terms of the things that they might want to do. So I know Stephen's looking at me quizzically because maybe he didn't want me to say that, but that's not new information. I mean, we've had that deficit from last year of 650 million. It was going to carry on with that run rate, but we did nothing different, and it's actually slightly worse.
Important to reflect on the higher numbers and extrapolation.
It is. Sorry, I wasn't in the meeting. No, it's in that context. So whilst we're in a good position, we sit in a system, we don't, we've got to think about the rest of the system.
Opting first within the
Thanks, Chair. Matt, that's really helpful and really honest sort of reporting of where we are. My ears pricked up, obviously, when you talk about the savings, and the table is helpfully there on page 10 of the 19 of the bundle. The ones that are marked in amber are currently about 500,000 out of our 1.2 savings plan for the year. If we're now in July, they're amber. If they start today, they may not achieve the totality of where they are, because obviously the later in the year you start, it changes, the less of a year it has to impact on the bottom line. Is there a plan B in terms of looking at, if all these magically turn green today, will we get to 1.2 million? If not, what else do we do?
So first of all those schemes that are amber, they weren't planned to start from the 1st of April.
That's helpful.
So some of them were planned for June, mainly because they are a lot of workforce, frontline service, redesign stuff. However, we had this last year, right? So I'm still concerned, and I think we need to switch on these, given we've said everything about the workforce difficulties, the gaps we've got. Redesigning a workforce in terms of changing skill mix doesn't happen within 4 months. So that's why I've said to the in my discussions with the divisions that we need to think about other things. In my financial plan, have got other things that will cover these in terms of non-recurrent measures that we can do. So you can be assured that I will cover. We'll be able to cover whatever shortfall, but that's not the answer. We need to actually come up with ideas and alternatives. Cover that off within the divisional services and not rely on accounting stuff that I can do. And that's the message that I'm just trying to give and be helpful and try and get, I suppose, support from my finance team where we can to help people.
Thank you, Matt. I appreciate there's only a finite amount of cash up your sleeve.
Yeah, and it's not helpful, it's non-recurrent stuff. These need to be recurrent things that we do get change the way we deliver services, or procurement savings are ongoing improvements, stuff like that.
I was just going to pick up a comment really from QSP point of view. We've picked up that point of the challenge about recurring savings rather than non-recurring. So I get the point that's just been made, but I think the focus in terms of any challenge to any scheme delivering needs to be really recurring. But I think as we should do in QSP, the quality impact assessments, particularly on those workforce issues that Matt was just outlining, is really key, that we understand and have got that assurance around the quality impact assessments on any of those schemes. So I think that's important that Matt keeps us briefed through QSP and obviously the board as well.
Thank you.
Sorry, Chair, we've got that some in our original IMTP financial plan, there are things that have moved on since then. So, for example, energy prices, and we've locked in with a new contract with Crown Commercial Services, so which locks you in for forward buying and pricing of energy, and so there is improvement in the plan. And so when you look at the 1.8 million savings target we set, it was based on not knowing that at that time, and having to potentially cover a 500k cost pressure on energy prices that Welsh Government will no longer fund. So it might be that I'm saying also that plan now releasing that energy cost pressure because it's no longer there. And so the 500k in theory, which was related to this higher target, because that's what we did, we had to set higher savings targets to cover it, is no longer required. I'm not in that place because I think we need to have a program of savings anyway, but there is that 500k that in theory that target wasn't that level last year or the year before, so we've never done 1.8 million. So it is a stretch target because we're trying to cover an energy prices the Welsh Government weren't going to cover. Prices are stabilised, as you know, and actually started to drop quite a lot. And we've got that locked in, so there is in theory 500k released from our plan at the beginning of the year, and we could say, well, actually the target was always very difficult. Let's not go. I mean, I'm saying this publicly to everyone, but I mean, it's not a message that we're in at this point. We're still going to try and drive forward with those savings targets.
But you put your hand up as well. I don't know whether you want to go first. You just want to
I just think. So I think identified these rabbit hole that gives us more flexibility and allows us to manage and go ahead and push it. describe it. So we thought they were a good idea. We need to make them recurring. If we don't need them because the energy's gone down, we will need them because they don't put pressure to not let it all away in the system.
Yeah, just in reflecting really on recent events, and we had a good discussion at Integrated Quality and Safety Group about some fantastic work that's happening at grassroots level within divisions. In particular, we heard about the 5-minute improvement work that's now really growing some significant momentum within the Welsh Blood Service, where people are owning and leading a lower level change and transformation within their services and areas of responsibility, are being empowered to take things forward and lead improvements. So I suppose my question is, are we confident that we are tracking any recurrent savings that may be coming from that work at grassroots level, really, that have probably emerged since our initial savings plan was identified? Because again, there's lots of little things, but they may have a moderate impact.
It was something that I'm going to pick up with David Osborne, who's my finance business partner, because obviously for me, there's all that work that goes on that helps the overall financial position, but not just the financial position, improves the services across that we don't capture, because these are the official status targets that each of the SLTs and divisions have come up with and signed off. But like you said, it doesn't capture all that other work that's ongoing, so it's an important point because we should be flagging that as well. This is having this economic financial benefit alongside all the other improvements. And also we discussed about, well, is that happening across the trust? So how do we get, people on the coalface with all their good ideas, because they're the ones who like to improve things, not, I certainly don't. I can help people do it, but I'm not the one who's going to spot the areas of improvement. So is that happening across the cancer services? And so it's a good point. And we're not, the honest answer is, I don't think we're capturing it here. I'm sure the service divisions are capturing it somewhere, but probably in lots of different departments and not in one place.
And learning across as well. There are learning opportunities across from that work.
So,
Thank you, Gareth, please.
Thank you, Chair. I wanted to focus for a minute, Matt, on the other financial risk, which you highlighted, which is the DHCR one.
Yeah.
And put simply, we're not charging our commissioners for all the activity that we're doing. And there are a couple of questions. First of all, you quoted a figure of 2 million of income there. Is that to date, or is that over the whole year? And is it a continuing, I suppose, failure to charge correctly? And secondly, given the pressures there are on local health boards, what level of confidence do you have in our ability to claim that back from them? Because obviously the longer it goes on, the harder it's going to be to get the money from them.
in terms of the first question, it is for the whole year. It's a forecast, and it's a forecast based on probably month one even, because activity data is always a month behind. So it's an extrapolation, as Steve said, so it's not even forecast. The month 3 report, I downgraded that risk because Kath and the cancer services team have done a lot of work, because obviously I flagged that as a major concern back in May. And in May, I think we had the conversation, or even the beginning of May. So a ton of work has been done in terms of the team resolving that problem of counting. So I'm not sure if it's completely resolved, but I mean, in terms of the income, I'm much more comforted based on the data I've seen. There's been a significant improvement. I've had conversations with commissioners in our commissioning meeting, because obviously there is an issue around timing, because our LTAs describe that we have to provide information at the latest within 2 months of the month end. So you have a initial information that goes out for the month on activity, then you have a period of wash up as corrections get made to it. In theory, they're in their rights to refuse to pay for that if it comes outside that. They've all agreed, because they recognise the difficulties we were having with the HCR system. They've all confirmed that they wouldn't not pay us within the financial year up to a point, because when you start to get to February, we lock down the figure anyway. So there is a risk at the back end, but it's significantly improved. I've downgraded that risk to a lower figure based on the latest information, but actually I'm pretty confident now that the position is either sorted or is a workaround whilst we temporarily change some of the other behaviour and system issues, so that we're not going to lose that. But I'll let Kath come in because she's the one who's done the work with the team, so I'm talking without that level of detail knowledge.
So the original cause of the problem was just the backlog in terms of the implementation, staff training, staff availability. So it was part of that programme. We did have one or two problems that we maybe might not have anticipated as the system bedded in, but they've now been addressed. The team were working on the backlog. They brought extra staff and overtime to resolve the process of the forms. The initial prioritisation had to be to make sure patients were the activity was related to patient needs and making sure that patients receive their treatment in time, and obviously dealing with the financial element alongside that as well. But as of June, my understanding, I haven't had an update from the team in the last 3 weeks, but my understanding the last time I spoke to them was that they were back in real time and that the backlog had been addressed. But I can provide you a more detailed update, but wasn't on my worry list because based on the last report that I
Thank you.
Thank you, Gareth. So question on this, if not, I'm going to move this to the recommendations. So this is the two sets of documents. So the 6.2, those documents, I'll deal with those first. That's the performance management framework for May 23, which Carl, Kath and others are taking us through. So we've been asked to note the content of that report. And the detailed performance analysis provided in performance management scorecards with supporting data analysis templates in annexes 1 to 3. Is the board happy to note that? Yes, thank you. And then we just concluded the finance report, which was 6.3, with an appendix. So what the board is being asked to note is the content of the May 2023 financial report, in particular year-end financial performance, which at this stage was reporting a break-even position. What I'm going to suggest we add to the noting is the important points you've drawn out, Matt, so definitely back for you, which is at the end of paragraph 2.2 in the cover paper, that in reporting a year-end forecast break-even position, this is based on 3 assumptions. 1, that all planned income is received. 2, the planned savings targets are achieved. And 3, that all financial risks are mitigated during 2023-24. I'm going to suggest we add that to the note in that. That's what the board has noted. It is a projected break-even position, but it is conditioned on those 3 assumptions. Yeah, thank you. So that concludes section 6. And
on the minute.
So it's now 12:40, and according to my agenda, I should just have finished section 6. So it's now a lunch break. We're going to reconvene at 1:15, please, and we'll reconvene with section 8, which will be the annual reports. So say we can break now and return at 1:15, please. Thank you very much.
Wow.
All right, good afternoon, everybody, and welcome back to the second part of the Public Trust Board meeting. So we're now arrived at section 8 of the agenda, which are a series of annual reports, which we will be going through individually, and which are items 8.1 to 8.7 on the agenda. Now, all of these have been firstly through QSP and been scrutinised there. So Vicky, before we start this section, wonder if you have any introductory comments in terms of scrutiny and assurance.
Certainly, thank you, Chair. I think it's important really to note for the board that Nick as exec lead for QSP really pushed to have all of the annual reports into one QSP. I think it makes it much easier to receive those reports all at once, although it's what I acknowledge, and I did in QSP, the significant amount of work and timescales that everybody's committed to get all of these reports here to QSP and here again at the board. But I think that rigor of process is great. I think it's, I think we're only 2 out, Nick. I think there's 2 remaining that we need to see. But I thank all the leads for all the work that they've done for all of the reports. So in total in QSP, we looked at 3 annual reports, which we noted. We approved 6 reports that you haven't got here today, but we approved. And there's 9 reports that QSP endorsed for Trust Board approval. So I think the one question that was raised, and we did have a discussion yesterday in audit as well, was just about the translation of our annual reports, because quite rightly, Steve Allen raised the point about translating into Welsh and publishing on the website. So I think that was picked up and we've noted that. But he talked to that point, given that he's absent today. He talked to that point, and I'm sure he would repeat that here today at Trust Board. So back to you to introduce each individual one.
Okay, thank you. So say we'll go through each of the reports in turn now. So the first of those is the annual patient donor experience report. I know that's led by you, Nick, but our colleague Jade Coleman is also online to talk to that as well. So I'll pass to yourself first, Nick.
Thank you. So I'm going to steal Jade's thunder. I'll leave Jade provide you with the highlights. I'm sure colleagues have all read the report, and then we'll take any questions at the end. Thank you, Jade.
Okay, good afternoon. As Nick has just pointed out, I'm here to provide a few highlights and key areas that have been included in the patient and donor experience report, which you've seen prior to this meeting. So firstly, I'd just like to highlight and provide an explanation on some of the percentages within the annual report that may differ from some of the performance report percentages that you've seen earlier in the meeting. They represent your Velindre experience only figures, and that's where some of the differences in percentages are. The percentages quoted within the performance report relate to the percentage of patients who have responded that their experience was 9 out of 10 or higher, as opposed to the overall patient and donor satisfaction score in our report. The report data set is different in the fact that within the patient and donor experience annual report, they look at overall experience percentages, and they combine the rates of both the Velindre Friends and Family surveys, as well as the Your Velindre Experience surveys. So I hope that provides some clarification for some earlier discussions that I think may have happened. Both reports have reported a high percentage of positive feedback, with Velindre Cancer Service reporting 93% of patients experiencing excellent service, and the Welsh Blood Service reporting 98% of donors advising that they were completely satisfied with their overall experience. The Trust have seen a steady reduction over the last 3 years in concerns being raised, which supports the high patient and donor satisfaction scores that we've seen over the past year. However, we would continuously strive to improve in any areas where concerns are raised and make sure that they are a priority for the Trust. The introduction of duty of candour, with the introduction of that, the Trust are developing some always-on reporting metrics, which is one of the requirements. And under that development, we aim to go live on the 1st of August of this year. And these metrics will be presented in a dashboard style format, which will include initially patient and donor overall experience themes, and then they can be broken down then by the Civica survey questions for more detail if and when needed. And then finally, following some feedback from the Quality and Safety Performance Committee, we've created a patient and donor experience one-page poster in relation to the report, which is being reviewed and will be ready for circulation in the near future. So in saying that, we look forward to any future engagement with all of our patients and donors, and happy to take any questions. Thank you.
Yeah, thank you, Jade. The only thing I wanted to add to that is, you know, we have been on this journey with a certificate electronic experience software over the last year. As you will see from the report, Welsh Blood went live with that in August and has had a significant number of donor feedback as a result. What we now have to do is to really make sure that the momentum is gathered across the cancer service, and I must say, you know, the departments and directorates there are owning this, and they have all now got, you said, we did boards up and are encouraging feedback from patients. It's sometimes a little bit difficult because patients don't just go to one department, so I think we've got to be very careful of survey fatigue as well, because our patients span across, you know, very often a number of departments within the cancer service. But really excited to see how this has emerged really and developed over the last number of years. And the most important thing is the fact that we are looking at the feedback and making changes as a result, which is why we're actually doing this. So we'll take any questions.
Vicky, please.
I think just to pick up, and apologies to Nick because I didn't pick this up in QSP, just on your exec summary at the bottom of that first page, where you outline about the number of complaints. You've got about the comparison in 2 years that we look at the same, so 119, 21, 22. And then, oh no, it is right, 2021, so ignore me, ignore that. And what I would support is your level 4 level of assurance. So apologies for that error. I think that the bit that I guess I would like to see in future reports would be where we're looking at the number of complaints, is the number of themes of complaints in terms of the decrease. So if it's particularly in Welsh Blood or it's in a particular area in VCC, that actually the number of complaints on those areas have gone down as a result of the learning. Because I think the report really helpful bringing out the learning and how you're applying for that. But I think then specific outcomes would be really helpful to share that.
Thank you, it's helpful. Carl, please.
Yeah, thanks, Stephen. I've had a look at this in the previous meetings. It paints a really good picture. I guess 2 things. One thing, just a slight tweak on page, I think if I read it rightly, page 654 of 1194. Top box there, 85% indicate their experience was that within actually the last 6 months to time, just a clarification. So they've been in our service within the last 6 months. Is that what it's saying, or is there a word missing? Was good. So just question, I'm not sure. Just point of clarification.
Right, so I'm on 654, which is page 14.
I think it's in that page 9 of 20.
Is that just a time thing? So they've touched our service in the last 6 months. So I'm just giving the context. So that's top.
Yeah, no, I think it is right. It's saying
That's
that
what I'm asking. Is that right?
I think so.
Okay. But the second broader point really was, we discussed this a little while ago. There's some really good numbers in there, but I guess back to Nicola's always challenge, you know, what does really good look like? And some of those numbers in there then, so 14% of patients said they weren't always listened to, 15%, or 93%, so 42% said they wanted. So it's just, that's the thing to go at, isn't it? That's the room for growth for us. So I think that's what we're all here to do, isn't it? So some really positive stuff in there, but there's still a lot of room to make it even better.
Yeah, no, absolutely, which is what the most important thing is, and we should see those changing, shouldn't we, if we have been effective at doing that. And yeah, and that 85% is that they received treatment within the last 6 months.
Yeah, I've got a couple of questions, if I may. So whilst you look at the percentages are high, is it considered recognised, excuse me, that the number of responses is a pretty low number? So whilst you look at the year, it's 1,000, but if you look at the last month, we're talking 44 patients for one of the surveys, and I think 55 or 56 for the second. So I suppose my sort of challenge from the patient perspective is, how do we get more patients to submit more information that becomes qualitative feedback, and dare I say, the risk of the 85 or the 95% target and actual, is there a risk that that could sort of become the focus rather than sometimes it's the core data? And then coupled with that, is there a view then that if you get more patients, would you then start to, in a way, dissect that? So we talk about patients and we talk about family, but do we know what the information that we've got, how much of the information back is from our patients and how much of it information that's back is from the family member? And then are we starting to look at who says what? So I suppose it's great that we got a target. I understand that as a trust, you would have a target to achieve, but how far do we want to go into getting more patients to give us more information and then really start to drill into what different patients, family members are actually saying? And then my last question, or just point, I suppose, is it's right to have complaints, isn't it, under patient feedback, but how do we ensure that when we don't solely concentrate on official complaints, and is the emphasis on providing feedback and change for the comments? Is that quite an equal sort of scale?
Lots of really good questions in there, and absolutely the priority now, as I think I said at the start, is to get far more feedback from our patients because the numbers remain low, and that has to happen at source, and really encouraging services. What we didn't want to do is put a target of a certain percentage of patients giving feedback, because some of the patients, for example, those come into the assessment unit are very sick and well, and so it is a sensitive area as well, but it's absolute recognition across the whole cancer service that the number of patients that we get feedback from is too low. And we are working with the individual managers and departments on how we increase that. So that is has been a priority since April and is continuing to do so. The Civica system does allow significant drill down. It tells us which set the patient is being treated under. It tells us what departments they've been in, so we can really look at the information in detail. And the majority of the feedback are from patients rather than families. So that's the what we've been trying. The friends and family test is, would you recommend this sort of service to your friends and family rather than encouraging friends and family necessarily? But this is a start of the journey for us. There's a lot more we need to do, and we're really good to engage further with the patient liaison group, isn't it? Because I know you guys supported us initially when we were starting on the Civica journey. I don't think the surveys are right either, but we haven't changed those because there is a national piece of work that's been commissioned where third sector organisations been procured to look at what the experience framework and survey questions need to be for NHS Wales going forward. So they will change as well. So we thought we didn't want to change and then change again. So we've added the simpler survey in just for now, but there's a lot more work to do. And your last point about focusing on learning, that is exactly what we need to be doing. We should, every divisional directorate meeting, every senior management team, leadership team meeting should be having the patient feedback of the previous month there. What does that mean for us? How is it going to help us prioritise? And how are we going to, how are we engaging with our staff to shift and our patients to shift that experience and improve it where it needs it?
Okay.
Thank you, Nick. Martin, please.
Two for me, if I can, Nick, in terms of challenging and always improving, etc. This section talks about putting things like talks about concerns received by patients and donors on page 18 and 20. It therefore doesn't talk about staff. So I presume there's other reporting routes for staff to report their complaints. How we learn from those.
I'll hand you over to Sarah for that one.
Yeah, absolutely, Martin. And this system at the moment doesn't do that. We have a variety of systems. We use our working confidence platform, and people actually want to report in through that route. We're also aware, of course, and we haven't had a national staff survey for a number of years. That staff survey will be running from September this year, so we'll now be able to lock into an annual cycle of national staff survey, which is an extensive question set.
Yeah.
And we'll also then be following that up with regular pulse surveys, which we've done intermittently, which do give us a flavour and do give us a temperature check, but not consistently and planned for a year in advance, if you like, in order that we can put that in place. So I think all of these things together then, along with things like exit interviews and what we will be implementing in terms of remaining work interviews. So if we get an indication that there's an issue with anyone, we're actually going to, rather than say, well, you know, they're leaving, we'll do an exit interview. Well, let's talk to them now. So we put in a number of those things in place as well to continue to take that temperature check.
I guess just in terms of triangulating, it'd be helpful for that information to come in at the same time as concerns raised by patient donors, because again, we talk about learning on both of them, I suppose. My final observation is that the section here about concerns received by patients and donors seems to imply that a reducing number of complaints is a good thing. And for a learning organisation, that isn't always the case, of course. You actually want people to raise issues with you, and you want to make it easy for people to raise issues with you so you can learn from them. So again, we don't know the detail of what's included in here, but the kind of language just, it says that suggests that trust is learning and improving. But I'm not, I mean, a lower number of concerns isn't always a good outcome. Thanks.
Thank you, and I absolutely take your point. However, what we have got is a lot more about staff actively encouraging and trying to resolve initially and preempt concerns. So some of the challenges we've had of late, for example, within radiotherapy, where we lost a Lynette for a while, which resulted in patient treatment delays and appointment delays rather than causing disruption. The head of department, unprompted, wrote to every patient, explained what was happening, where it was happening, apologised in advance. So I think we're getting much better at proactively managing situations and trying to, preempt concerns and better communicate with our patients and donors in those events. So I think, take your point on board, that could probably be worded a little bit better. And the other thing we have picked up on this point is we need to make sure that every department that is donor and patient facing has information up around how to raise a concern, and that is a piece of work that we still need to do because it's not quite in place everywhere. So just picking up on your point, Martin, I think we need to relook at that as well.
Thanks both, it's really helpful.
I think just to back up or pick up on what Martin was saying about staff feedback. I know Hillary's online, but I think Hillary recurringly through QSPs, and she has been raising the issue about staff feedback and the themes that come from that. And that's obviously work that you're going to be bringing back to QSP, which is great. But I think just to make that point, that has been discussed in QSP.
Thanks.
So sorry to hear you're not so well today, Hillary. I thought so with you. Thank you. Thank you for the thumbs up. Right, any more comments or questions on this particular paper? It's here for approval. So we request to approve the 2022-23 Trust Patient Donor Experience Annual Report. And my understanding is it will be agreed to translate that into Welsh prior to publication on the Trust website. Note that as well. So we're happy to so approve. Yes, thank you.
Can I thank Jade ever so much and the divisions for all their hard work in this area over the last year.
Yep, we certainly echo those thanks. Thank you, Jade and the team and the divisions. Thank you. Right, that concludes 8.2. So we now move on to 8.2. Doesn't that conclude 8.1? And we move on to 8.2, which is the Putting Things Right Annual Report 22-23. Again, led by yourself, Nicola. But we have with us Zoe.
Good afternoon.
Presenting on this. We'll pass it to yourself, Nick and Zoe.
So thank you. Zoe's in our interim head of quality and safety role, so has only been with us for a short period of time. So just putting her on the spot this afternoon. But again, this report for the first time we're including claims inquest redress in this report, whereas previously that would have been reported to Part B. So we felt it was important for total transparency that we provided the whole picture within these reports. So I'll hand over to Zoe. Thank you.
That's
Lovely, thanks Nicola, and thanks everyone for having us here today. So it's already been mentioned, I'm here to present the annual PTR report. So this report provides an overview of trust-wide concerns activity that have been undertaken in the period of the 1st of April 22 to the 31st of March 23, and details key issues and outcomes relating to performance, concern analysis, key themes and trends, and learning and continuous improvement that's occurred as a result. So for a couple of positive and sort of key points associated with this report, I think the report positively reflects and supports the Trust approach to concerns management and its alignment with the Putting Things Right regulations. Obviously, there's always opportunities to further improve our management, but I think through some of the auditing and review processes, we are now in a better place from an assurance point of view that that's occurring. I think secondly, the report also has been discussed previously, just demonstrates our ongoing commitment and focus upon actually actively listening with our patients, donors and families, and engaging with them when things go wrong. And I think this is really key and important in enabling us to identify and address areas of learning and areas of focus for continuous improvement. Because at the end of the day, as has been mentioned, complaints and incidents and all other aspects of concerns are a gift that really enable us to maximise the experience of the patients and the donors across the organisation, and ultimately lead us to achieve our requirements under duty of candour and provision of safe and high quality care. So moving forward then, the report also identifies our opportunities for the coming year. So we never sit back on our laurels and we're looking at what's next. So I think the key points of focus that we've identified are the implementation of the health and care quality standards. There's quite extensive review of existing policies and procedures to ensure alignment with regulatory requirements, and particularly the duty of quality, duty of candour. We're very keen as a team to have a strong focus in the coming year also, and it goes back to staff feedback as well, really, upon that of compliments and compliment reporting, because I think there's still work to do to optimise the collection of compliments, because we consider it's equally as important to know what we do well, to both celebrate that and continue providing services that are actually well valued and provide excellence and experience. So I think it's quite easy sometimes to concentrate on what went wrong, but I think it's equally as important to look at what goes right. And then finally, we're very focused on a large piece of work within the quality and safety team, and that is to develop and implement both a quality management system and systems that will enable always on reported, as Jade alluded to. So it's really about triangulating the information that we've got to inform our quality approach and ensure we continue to provide high quality and safe care across the Trust. So that's my brief report, and obviously welcome any questions or queries.
Thanks, Zoe. So just a couple of things to add to that is, we are on a journey, and we're definitely not where we would like to be or need to be, but it's really, really positive, and year on year we continue to enhance what we are doing. This year we really had a bit more of a structured approach for thinking about what occurred during 2022-23 and how that can inform our safety priorities and our safe care collaborative priorities as a Trust, and also our clinical audit plan. So we actually did that through the Integrated Quality and Safety Group, and we were able to make sure that there were themes that we identified. So, for example, the SACT telephone helpline. So that's translated into a safe care collaborative piece of work, and that arose from a number of incidents and some national reportable incidents. Also, the spinal cord compression pathway, because we had a number of incidences and negative feedback from patients in relation to that service, and also some audit work in relation to line management within the cancer service. So we've really, for the first time, formally and in a structured way, started to use the outcome from the intelligence we get from the data system and other systems to inform the further scrutiny and assurance processes we've got as an organisation, which I think is really positive. Still a way to go, but it's definitely a step in the right direction.
Okay, thank you. Vicky, please.
I think just to comment on the exec summary, so I was commenting before on a level of assurance with Sarah, but I think in QSP you'll see in the narrative that we actually challenged Nick to be a more positive level of assurance in terms of going from a 3, which she'd advocated in the report, to a level 4, which I think is absolutely right. But I think the benefit of the integrated quality and safety meeting has really helped that debate. And it's good that actually, particularly as exec lead, to err on the side of caution and put yourself lower. But then I think the challenge in QSP is to challenge up or down based on the evidence that we see. I think the evidence within this report is very positive, but I take Nick's point that there's continuous improvement, which is absolutely right. But I think it's good that we were able to challenge and increase the level of assurance.
If I may, the other thing I didn't add, which I meant to, was picking up on the point about improved concerns management, and there's been a number of Public Service Ombudsman Wales reports that have been published in relation to NHS Wales bodies in recent months. The Trust has not had any of those, and in fact we've just had 2 letters in the last month from the Ombudsman who outline that yes, there were areas of our care and services that could have been better, but our investigation was robust, and the feedback that we provided to the complainant was transparent and open, which I think is really positive. And therefore they did not pursue with an investigation.
Any further comment or question on this before we move to which we're noting, obviously, Vicky, that the assurance level has been increased in terms of this report from the 3 as presented to QSP to a 4 following review by QSP. So on that basis, I'm asking the board if you're happy to approve the 2022-23 Putting Things Right annual report, noting that following approval that be another document which I believe will translate into Welsh prior to publication. Yeah. Thank you. Are we happy to do that? Yes.
Yeah.
Yeah, thank you.
And again, thanks to the whole team, the quality and safety teams across the organisation, which have gelled together really well. And thank you, Zoe, for your recent leadership.
Yeah, thank you very much, Zoe. Please pass that thanks. Thank you. Right, that does deal with 8.2. So I'm going to move us on to 8.3 now, which is the Local Partnership Forum Annual Report for 22-23. It's led by yourself, Sarah, and this one is for noting, not for approval.
Thank you, Stephen. Just a few key highlights. First of all, obviously, this is the annual report of the Local Partnership Forum, but also contains information relating to our broader perspective on partnership working. Trust obviously is committed to working with trade union colleagues through service change and through generally working closely together. That within a landscape of quite difficult industrial relations, as we have seen over that time period. We've achieved that in the organisation, I think, but by having clear and transparent relationships and really building those with trade union colleagues. We do know, however, that the organisation doesn't have the strength of trade union representation that we would like in order that we can completely fulfil our obligations under partnership working. And that means we rely on the same individuals quite often to come to meetings, to have conversations, and to be active and participating in organisational change and so on. So you will see that the one thing I wanted to pick up really, that in the report it talks about the partnership working action plan, and this is something that QSB asked for a bit more clarity on. What do we mean by action plan? So hopefully this is clarified in this version of the report. This is really where we are working with trade union colleagues to say, what do we need to do differently in order to strengthen partnership working? For example, we should have a joint chair of the LPF, myself and a trade union colleague. We don't have that at the moment. So that's just one symptom of the fact that our rep base is quite low. So one of the things on the action plan is how we're working together to discuss with staff their opportunity for becoming reps, becoming learning reps, if that's a route into becoming more broad trade union representatives and so on. So that's one aspect of that plan. And also I'm glad to say that the trade union colleagues have now started to meet as a group, which they weren't doing previously. Colleagues who've been used to other organisations may have been used to that way of working. We haven't had that here for the reasons I've just described. So that is another step forward. So I think we've been quite proactive. But we do still have that issue, so I just wanted to make the board aware of that. So clearly what we've done here is outline some of the conversations and themes we've had through the meetings in the year in question, but happy to take any other questions on that, Steve.
Thanks. Any comments or questions? Thank you very much. So the report is here, and asking the board to note this report, please. Thank you very much. That leads us on to 9.4 now, which is the Equality, Diversity and Inclusion Annual Report 2023. And this report is here for board approval. And again, Sarah, we invite you to take us through it.
Yeah, absolutely. Again, to pick out some of the key points, this is our under legislation, we're required to publish, excuse me, frog. We're required to publish the Equality Annual Report for 22-23 by March 24. So we've brought this way ahead now to fit in with this QSB cycle, which actually is quite helpful because there's no reason why we should wait another 6 months before doing this. So it's quite helpful to see these in a round, isn't it? So what this does obviously is under each of the protected characteristics outline our demographics as an organisation. And one of the comments that Hilary made in QSP, which is absolutely right, was to say, can we reflect under each one of those sections the comparison between the organisation and the demographics of the population we serve? Given that we've got both regional services and national services, what we've got within the report is the national demographic in order that we can compare at that level. We haven't been able to really effectively break that down into a specific population within Wales because our staff are obviously from so many different parts of the country. So what we can see then here, as I said, then is how we compare to those All Wales figures, where we've got them. Some you can see marriage or civil partnership is not available. So again, happy to take any questions.
Thank you, Sarah. Any questions or comments on this report? If not, oh, sorry, Martin.
Sorry, can I just thank you. Very helpful report, and I wonder whether the All Wales profile is the right answer, because I suspect the majority of our staff are indeed spread across Wales, although I know that some absolutely are. We are very much a South East Wales organisation, aren't we? So I wonder whether some sort of weighting of the local authorities in South East Wales versus Wales might be a slightly better solution to that. Under item, you say we don't record on gender reassignment, then the comparator, it's not about gender reassignment, the comparator is about gender identification, which is somewhat different. I don't think that's appropriate to be there. Scrolling through to number 8, it says sex in brackets gender. I think most people in this area now know that those are two very different things, so it should be sex. And finally, just a kind of question about sort of how we look a little bit wider. 2121 on page 7 of the document talks about pay gaps, and we've got gender pay gap report coming on. I wonder whether we should be looking at pay gaps across other categories, such as diversity, such as Black, Asian, minority ethnic, such as disability. Whilst they aren't required to be reported, I know some organisations start to look in that area to see whether there's issues we need to deal with. Thank you.
Yeah, absolutely. In terms of pay gaps, what we are planning to do is to move into the race pay gap and actually consider that as part of the Workforce Race Equality Standard, which will be implemented in the next 9 months. So that is certainly one of the areas we need to move into to actually better understand that work. Absolutely.
Just in terms of Martin's observations about some of the terms of the heading, sex, practice, gender, etc. Is that something you perhaps have a look at? I know this is due for approval, but it needs tweaking a lot. I'm conscious it's been through QSP, so I don't need to do that either.
Yeah. I don't believe it needs tweaking for this version of the report, Chair. In terms of gender reassignment being the legal protected characteristic, we actually, as a data set, look at gender identity, because that's the way that people describe and talk about these issues. So we don't record that on ESR, which is why we're reporting as we are on here.
Just to push back on that, then technically that isn't the protected characteristic, and that's what section 2 heads up as. So you're right, Sarah, and I'm happy as long as we put that clarification. Be happy.
Thank you. Edwin, please.
I was taking board the comments about being predominantly South East Wales, and also did mention the fact there are people around the country. I just think we need to be slightly cautious on that, in that we could perhaps do both, but we do have significant numbers of staff in across Wales, and we wouldn't want to make them feel more isolated than they already are by focusing on that concentration in the South East.
It's certainly something we will look at for next time, in terms of can we actually delineate our trust-wide data in a way that makes the demographic comparison more effective. To just absolutely taking on board Edwin's point.
I'm conscious, Hilary, you had your hand up early, which I missed, and I only just spotted the note. And maybe it was for a, I can see it's back down. I don't know whether it was for a previous item, Hilary. My apologies if it was.
No, it's all right, Chair. Thank you. No, I just wanted to thank Sarah for adding those figures in so that we can have the comparison this year. Thank you.
Thank you. Apologies for missing your hand. Right, so in terms of this report, say it's here for approval, we've had various comments made. Are we happy to approve this report as a board? Recognize it says it's been through QSP. Yeah. Nodding heads, thank you very much. Thank you, Sarah. So now we're on to 8.5, the Gender Pay Gap Annual Report 22-23. You for approval again yourself, Sarah.
Thank you. So again, we're bringing this forward in our work programme to actually align with this reporting period. So the Gender Pay Gap report is required to report on mean and median pay gap and bonus pay gap. And for the requirements of the report, we are including ourselves as a legal entity. But then what colleagues will remember from last year, we also then started to look underneath that about what it means for us as a core trust, if you like. So what you can see is that we've still got that 12% pay gap, which concerns us as a core organisation, which clearly still needs to continue to improve. So the actions which we've put in place are listed in the main report, but also then in the cover paper, and how we're actually taking those through. So these are long-term actions to significantly address the split that we have in more senior management roles, and how that then skews the figures on behalf of the whole organisation. So very much recognising that actually concentrating on that is going to improve things over time. So that's the area of focus. We're also taking this into account when we're looking now at our strategic equality objectives, because as colleagues have said, you can't see this in isolation from the rest of the equality and diversity work that we're doing. And recognising that we need to think about intersectionality as well when we look at pay gap. So again, meeting our statutory obligation around gender pay gap. However, how does this impact people in different ways across other protected characteristics? So again, coming back to the point made earlier, that's something that we need to continue to grow through our work. So again, happy to take any questions.
Okay, thank you, Sarah. Any questions or comments on the Gender Pay Gap Annual Report? If not, I'll ask the board if you're happy to approve that report. Yes, thank you. So next is 8.6, the Welsh Language Annual Report 22-23.
Yeah.
Again, Sarah, yourself.
Glad this is the last one for me. Indeed. So well, Welsh language, this is a bit of a different area than the one you've been talking about a moment ago, isn't it? And what this report does is really reflect the journey we're on as an organisation. So we know we are subject to Welsh language standards, and those standards are wide-ranging and actually very impactful. We also recognise that we are not meeting the standards in 100% of the work we're doing as an organisation, both the standards that affect service delivery and the standards that affect the way we work internally within our own systems, processes and with staff. And what the report does do is clearly indicate the progress we've made over that year, recognising, I think, and I would pay testament to the work of the divisions in this, the way that the two divisions have established their working groups and actually owned now the elements of the Welsh language standards, and really recognise the difficulty in making some of these changes happen. So for example, when it comes to always answering the telephone in Welsh and always being able to conduct an initial conversation with a member of the public before they reach something which is more technical, and we are then able within the standards to hand that over to someone else. You know, we can't currently meet that all of the time or much of the time. So significant work needed. That's just one example. Significant work needed in that area to move us forward. Working very, very closely with managers in terms of language needs assessment when we're putting job descriptions together and job advertisements. And having that conversation around, well, the thing is, we've got recruitment difficulties at the moment, and how much is it going to add to that difficulty if we're saying Welsh language essential, which actually, if we took a purist workforce planning approach, is perhaps what we should do. That's just a reflection of some of the conundrum, effectively, that we're suffering from at the moment. So the report reflects the volume of work, the emphasis on the work that's happened in that year, but we know that we are continuing to be on a journey. It also talks about the Welsh Language Commissioner's investigation, which was launched at the back end of last year. We've now received the response to our response, if you like, in the last week or so, and we know that we are being held to account for the fact that we haven't met some of those standards, and that the expectation is that we meet them 100% of the time in all elements of the standards. So there's no grey, it's black or it's white. And therefore, you know, we're now actively pursuing how we respond to that as an organisation. So I've added something there to the annual report, but just wanted to reflect that context. Working closely with Gareth as the board Welsh language champion, really to reflect how we need to continue to grow this agenda. So
just thank you, Sarah, for that. Just to put some additional context around this. I attended a webinar with the Welsh Language Commissioner a couple of weeks ago, and her comment was that she was realistic but ambitious about what could be achieved here. But nevertheless, I think there is an expectation that we do meet the standards, and appreciating that that may give us some practical difficulties. We need to think innovatively about how we overcome those and meet these standards, because my sense is that the Commissioner will be taking a firmer approach with those organisations that aren't at least making a very good fist of trying to meet the standards. And I think key also is that we are in regular communication with her and her staff, her team, about what we are doing. But we need to be demonstrating that we are doing something and not just saying it's on the too hard pile.
If I may, yeah, no, I thank you, Gareth. You're absolutely right, and I think that's where I think for me, having an investigation report is something you don't want, isn't it? You don't want to hear that you've failed and that has been, you know, played back to you in that way. However, I suppose my mindset on this now, having read their response that we received last week, is now that presents us then with this platform and opportunity that we have to grab hold of in order to do just that. Because actually we can't say this is therefore that it's okay to be 75% of the way there. So we therefore need to take a very different approach to moving forward. So that's where I see the opportunity, because it requires us to have a slightly different mindset than we've had previously. So sorry, it's my glass half full. You know, we prefer not to be in that place, but we are, and therefore what are we now going to do, which is quite significantly different to shift us further along that road. So that's sort of where my thinking is at the moment. We now need to have those detailed conversations with the services to say, okay, practically, how are we going to do this? I'd also like to pay testament to Jo Williams, really, our Welsh language manager, for the amount of work that she's led for the organisation on this. And you know, this is a tough agenda when we have so many competing priorities in the organisation, isn't it? As we discussed today. And therefore, where does the Welsh language sit in that? And how do we make sure that we are, you know, paying full due regard to the standards? So, testament to her on that.
Edwin, just pick the first one.
Apologies, this is a bit of a personal perspective as an employee thing, so do stop me if I'm taking up time appropriately on that. But I have noticed as that that a fair bit of information does come up around about opportunities to learn and practice, and I know of several people who found the Cardiff University linked specific training helpful, at least two levels of courses, which were, I mean, not maybe academic strong words, but they were properly taught events. So it's just really to say that I have noticed that the opportunities coming around. I've taken some myself. I know of colleagues who have generally spoken very positively of those opportunities. So it's only a small aspect of this, but
that's very helpful. Thank you. Vicky, please.
Yeah, just wanted to pick up, thanks Sarah for her transparent and honest appraisal of the position, but that doesn't line up with what's in the 7 levels of assurance you put in here. Maybe it's an error because it says level 6 outcomes realised in full. So it's most probably a transcription error.
Indeed.
But I think we just need to adjust that in terms of publication of papers. And I guess generally across all of the ones that you've presented, Sarah, the others didn't include a level of assurance. I guess with what you've narrated across all of them, there are clear actions that could be in place. Based on those actions and the delivery of those, then next year, under our sort of interim report in QSP, it would be nice to be able to see that track through in terms of the levels of assurance. So look forward to that.
Yes, thank you, Vicky. I think we fell into that, the timelines around when we moved on to the new template, hence that's not consistent through this. But I will absolutely pick up the level 6 on the Welsh language. Thank you for picking that up.
Carl, please.
Just a question. Really. So there's lots of, Sarah and I talked about how we can get some of the relatively straightforward stuff done around automation of messaging and everything else. I just wonder whether there's any, given it's the law in Wales and given the drive in Wales, are there any discussions at a strategic level, public service, about almost identifying this skill as of strategic importance and attracting remuneration, i.e. on job descriptions, because that then would cost, you'd be investing in the skills. So for example, when we're saying essential speakers, we're then paying for somebody to go off and train and develop that skill set, because that may make the step change in Wales or not. I don't know, but there's something more fundamental that might need to be done rather than what we're just doing now, which is encouraging. We seem to be quite a way off where we need to be as NHS as well as public services, as well as we're not the only one in this position.
No, we're certainly not having that strategic kind of conversation at a national level in the NHS. We're certainly not having it across the broader public sector. I think just tangential to what you say, what we are going to start doing within the organisation, and I think more broadly, is to say that whilst we can appoint someone who doesn't have a level of Welsh, then it is a essential requirement that they learn certain levels, up to certain levels of Welsh, which is not something we've traditionally put in job descriptions or job adverts, but we will be moving to that. So actually we will find that as a bit of a step change then in terms of somebody having a mandatory requirement along when they take up a post, that they then learn Welsh, which we've not done previously. But that's one of the ways we can start to address the deficit.
I'm a little nervous around that, because that means if they don't learn to a certain level, we sack them.
Well, we haven't gone into that yet. But theoretically, we need a way of actually putting that in place, which is why we've not gone there so far. But that's the kind of thing which the Welsh Language Commissioner's Office is now challenging us to do, and to find a way to do within employment legislation context, obviously.
So I've got 2 hands. I think Stephen was just first.
I mean, this one might come probably more general about some of the others as well, about us describing what our ambition is and then how we want to get there over time. And I think we've had this conversation plenty of times, so moving away from the standards should then drop out of whatever our ambitions are. And I think we've had this conversation as well about years ago. I think it's really important for this one in particular, because we're missing the message about when we are as an organisation about the Welsh language, but I think this has relevant with some of the others on here. As we talk about, we've got this to do, we've got that to do, but where are we trying to get to? I think, is an important message for people.
Yeah, so just if I may respond to that, Stephen. Funny enough, I asked the Commissioner the question, well, within what period of time do you think it's reasonable for health organisations to meet these standards? Because she recognised that what we're doing is reverting a process and a way of operating that's been there for decades and centuries. And her answer was, you should have been there by 2019. So that, and as far as I'm aware, we haven't formally had an extension of time by which we must comply with the standards. So technically speaking, we should bring in a public meeting, but technically speaking, we're breaking the law. So to do it in due course isn't going to be good enough.
Steve, please. And then we can have a separate conversation. Yeah. I suppose I wouldn't describe that as, I suppose it's meeting the standards and where do we want to get to with our standards.
Okay.
Yeah. I was slightly distinguishing between moments slightly. I think it's an expression from us, yeah, as an organisation, what we're trying to achieve when for our standards. I take your point about the standards in 2019.
Yeah. Without pushing wrong, but I suppose the minimum, therefore, standards.
Yes.
And where we want to get to is beyond that. And where we want to get to is that we need to agree.
Yes.
Because we know what our legal commitment is.
On the same point, so here they have the first thing point.
Yes, if I may, I think absolutely, Stephen, and what we have developed is the Welsh Cultural Plan or Welsh Cultural paper from the organisation, which we've not brought through all of the governance routes yet, but that is about, okay, the standards are fine, more than just words, is another set of standards the Welsh Government applies to us. But what do we mean by that as an organisation? We're trying to add value to patients and donors here, aren't we, ultimately? And that's what needs to sit underneath all of this and all of the messaging. And it's easy to get caught up in action plans and lists of things. And I think Steve and I are on the same page about that. Is actually let's not forget that. That's what we're trying to get to, is actually embrace this as an organisation in Wales, within our context and within our culture, or embracing diversity within that in its widest sense as well. But recognising that no, we haven't, nobody has had any extension to the standards. They were applied in 2019 and we were expected to meet 100% of them on day one. So that's the context.
I just wanted to add to it, because across all of these issues that you presented, Sarah, then us as a trust board, it's a leadership challenge, isn't it, that we need to be leading by example. And having worked in another health board in Wales and having instant translation, I would question why we couldn't put that in straight away, because that's something for two non-execs that are first language Welsh. Why would we not just put on the headphones, got a person in the corner? It's a wonderful art to be able to do instant translation. But having seen that work, it works so well. And I would question why we wouldn't be doing it. So I think it's those things that we can put in fairly quickly. I know it's a finite resource, but actually with planning, same as we heard from your representative in QSP in terms of hearing translation, in terms of BSL, same sort of issue, planning for it, putting it in place. So I just think it's an issue of leadership for us as a trust board that we need to pick up.
Just to say, it is a challenge I have put to the executive team about how we achieve that in relatively short order.
Thank you.
I know the chair is the proper chair.
Oh, thank you.
He's very supportive.
As am I. Right. Well, I'll bring us back to the report as is. So, oh, sorry, Hilary. Sorry, your hand is up, Hilary, please.
Yes, thank you, Chair. Sorry, it was a bit late. Yeah, I just wanted to add to that the Chair has been looking at ways of getting instant translation into meetings, but I think there was Welsh Government were thinking about developing a process via Teams that hasn't emerged. So I think the last conversation I had with the chair was that she was going to go back and see whether there was something in the interim that we could introduce. Thank you.
I mean, just follow up on that, the only solution is in person.
Yeah.
There isn't anything else. That is the only option, and that's what government do as well.
No.
Sorry, Lauren, I didn't hear that.
It is.
Sorry, Lauren. Well, sorry, Lauren, please. So here we can hear.
So in public government meetings, so public council committee, etc. So there's 4 translators, depending on the length of the meeting, and then they're instantaneously translating in this transcript for 3 minutes at a time or whatever they do, and they just go round and round and round. In terms of what Vicky and Gareth are saying, that would be somewhere in the corner of the room. So basically, there isn't a technological solution that's imminent at all.
Maybe we can take it offline. I am aware of a translator who does it via Zoom.
Yeah, sorry. Yeah, of course. Yeah.
Yeah, that I think was my confusion there. I mean, it's done with a person in the room, but it can be done with hybrid meetings, because I know a number of do.
Oh yeah, no, sorry, I wasn't. I was saying in the corner. Yeah, virtually. Yeah, it's a full-time person. There isn't a technology option.
It's a manual.
It's a technical
Personal process. Personal process. Okay, right. I need to bring us back to the report. These are obviously important matters which we will take to normal business as usual. So thank you for raising and reminding us of those. But if we can come back to the Welsh Language Annual Report, there's no questions or comments. It says we accept the report. So we signed up for noting or for
approve it. Sorry,
approving. Yeah. So the report is here for us to approve. We'll be happy to approve the report. Yes. Thank you. So lastly, in this section 8.7, back to you, Nicola. It's the Professional Regulation and Revalidation Assurance Report 2022-23. This has been the last of the reports that went through QSP.
Thank you. So this is the second year that Dr. Abraham and myself, as the professional leads, have provided an assurance report in respect of have we maintained our responsibilities as an organisation in relation to professional revalidation and registration. So as you can see, the only issues we've had in year relate to nursing predominantly, where we had registration lapse due to failure to revalidate and a revalidation issue. On both occasions, neither of the nurses worked without a live registration, which is positive, and we've taken steps to try and address the issues that arose following the investigations of these matters. The 3 medics where there was a delay in the appraisal, there's just a slight delay, did not affect revalidation of those medical staff. So I will take any questions.
Thank you, Nicola. So any questions or comments on this report? Is also here for approval. If not, thank you. I vote to approve that. Thank you very much. After my early success this morning of sticking the time, and now about 20 minutes behind schedule. It was scheduled on break, but then, unless anybody objects, I propose just to carry on rather than have a break at this point and try and catch up 10 minutes or so, given how much more we're going to get through on the agenda.
5 minutes. Yeah, 5 minutes.
Oh, 5 minutes, okay, yeah.
Yeah.
We're going to take a break for 5 minutes?
No, you don't. I just say we're just only happy to carry on.
All right, yeah, yeah, so that's fine.
Not up until our time.
All right.
All right.
So my timings were 13:55 to finish that.
10 past, we are on admin controls.
Okay.
I printed it off 2 days ago.
Oh, right.
Right, well, we'll carry on now. So we're now going to get into section 9, which is the planning and strategic development papers. There's 4 there. Just as chair of the SDC, just to say that 3 of these have been through the strategic development committee, including almost an assurance process. The 9.3, I think, has come to the board directly from TCS scrutiny, as I rather than to SDC, wouldn't normally come to SDC. But I've got no further introductory comments. The one thing I do want to check is I know from 9.4, Professor Velindre Evans will be joining us. I obviously don't want to be holding her up.
I was just saying 9.3 was endorsed by the audit committee for.
I was.
Because obviously as chair of TCS, you asked the audit committee.
You're right.
This whole framework is based on.
Yeah, you're right. Actually, yes, just come up to a stall. That's 9.3 to second. So just in terms of, before I plough through these papers, I'm not sure what time we are.
Yeah, Miranda isn't on yet. I'll confirm with Leanne in the background.
That's fine. I will, or we can keep a lookout so that when she does join, I'll then take that paper as the next one after the one we're on when she joins. We're happy to proceed on that basis. So that gets us into 9.1, which is the paper regarding the approval for the replacement of a third linear accelerator at the current cancer centre. That's with you, Kat.
It is. I'm going to give a very brief introduction and then see if anybody's got any questions. I think in my introduction, what I'd just like to point out is the fact that the ongoing fragility of the fleet, and we have suffered from having LA7 down for some considerable time the last couple of months. I think which just goes to illustrate the timeliness of this replacement programme overall. We're seeking to replace a third Linac, which is over and above the two that were originally planned, both on the understanding that it improves our fragility. It also enables us to have continuity of service because we've received end-of-life notifications on two of the other Linacs that we've been working through, and we now have confirmation on that. As importantly as all of the rest of that, now that we've got the very much more detailed timeline, we know that there's a narrow window of opportunity within which our highly specialist staff can actually undertake this. So with all of those things coming together, we're seeking your agreement. We're not actually seeking your endorsement. It's on paper, we're seeking your approval. So apologies for that. And just to give you an assurance that we have had early discussion with Welsh Government on the capital, with Varian on the contract arrangements and their ability to meet that request if and when we initiate it, and also that the necessary adjustments are taking place with the MVC for business case. So just happy to take any questions.
Thank you, Vicky, please.
I think just for clarity of my understanding of the reading of the paper, it's that actually the third Linac, it's a phasing issue in terms of that was already in
it was already in the contract.
Bringing it forward.
Yeah, let's bring it forward.
So I think that's just important point.
Yes, thank you.
Can you say this is your for approval? Yeah. Was discussed at length at SBC coming here, strategic development. Comments or questions on this paper? If not, we can move to approve proposal and authorise the recommendation to proceed now. Place a third linear accelerator at the council. Thank you. So next up we can take 9.2, which is the Velindre Oncology Academy. This is going to be led by Nicola. I see some support with you as well. And this paper is requesting approval in principle to the development of the Velindre Oncology Academy. Still pending consideration of the actual business case, but it's the principle of this. So I'd like to hand over to you, Nicola.
Thank you. First of all, I just wanted to thank Hannah for all her amazing work and the development team in getting us to this position today. What you've got here is a bit of a plotted background and an overview of the case and the proposed impact of having Velindre Oncology Academy. The full business case is going to be covered in part B today. But I'll hand over to Hannah just for a couple of highlights. Thank you, Hannah.
Yeah. So in terms of the business case, what would you sort of like me to just
describe benchmarking you've undertaken?
Okay, yeah. So as part of the benchmarking exercises I've undertaken, I've been in contact with all the academies and the schools that are currently in England. So we've got the Christie's, the Marsden, Guy's Cancer Academy and also the Clatterbridge. In terms of sort of stakeholders, we've engaged with all the professional groups within the Cancer Centre. We've undertaken a scoping exercise of the existing education resource that is actually in the Cancer Centre and all the courses and education that we've been provided. It was quite clear from that exercise that we were working in silos. There was also a lot of inequity across the professional groups in terms of resource and education provision as well. And because of that, there was also a lot of repetition happening. It was also sort of, we've done a lot of staff engagement events. We don't feel like that we're covering enough education and training that we should be. We're outsourcing a lot of things to universities in England, for example. There's massive requirements now in terms of workforce education and with the developments of clinical treatments and all that kind of thing. So for example, our SACT nurses are required to undertake a SACT module. We're currently outsourcing that to Guy's Cancer Academy in England, but we have all the expertise in-house in order to deliver that ourselves. I think the biggest thing that sort of, for me, is the changing landscape as well. So we've got a lot more digital capability now. So we've got the capability to deliver courses outside of our own area as well, across the nation. A lot of courses that are being delivered outside of Wales are being done digitally in a hybrid fashion. They can be accessed by the learner at any time. So in terms of staff accessibility, it increases that also as well. Sorry, so yeah, I think there's definitely the stakeholder events, the scoping exercises have all clearly identified a need for this academy. It will benefit the organisation in terms of recruitment and retention. There is clear evidence out there that suggests that staff well-being, people who are allowed to develop, are allowed to undertake education, it does impact their well-being. And ultimately, it's hopefully going to benefit the patient. As we've sort of, we need to provide an agile workforce. We can be behind the curve a little sometimes with some of the new treatments and things that are coming through. I'm just thinking of things like immunotherapies at the moment. There's no course out there at the moment that's specifically for immunotherapies. So we've also identified gaps in the market as well with other new therapies that are coming through as part of that immunotherapy umbrella. We've just seen gaps in the market in terms of acute oncology as well. So there's so much that we could be doing to benefit our workforce, which then ultimately will benefit patient. There's nothing like this in Wales. There's no specific master's pathways for oncology as such within Wales either. It's very much a case of picking and choosing off a shelf, what feels sometimes that it's with picking and choosing off a shelf to make up those credits for certain things. There used to be masters in oncology and haematology through other universities in the past, but there was never the uptake. But what we've sort of seen from looking at what they've done, particularly in Guy's Cancer Academy, is with that digital platform, that digital capability, new digital ways of working, that we've got a way of accessing people outside of that area as well. And we do have the expertise in-house to do that. We are the experts.
Thank you for that. So we're absolutely clear from the 18 months work that Hannah's been doing that we've got a robust case for having an academy that will service not only the trust but Frenchs Wales and wider, and that will be a key enabler for us to meet our strategy, our vision for the future, because it will help to develop our staff, ensure that we can deliver services in real time. And also be a key recruitment aid for us as an organisation. We've considered 3 options within the Strategic Development Committee, and one was just proof of concept work. the to minimum hours, it would continue as we did with proof of concept, but then to establish the full academy, and it was option 3, which is establishing the full academy that the strategic development committee endorsed. So what I'm looking for from the report today is approval in principle, pending receipt of the full business case, to proceed on that basis. Thank you.
Thank you. Again, just clarify, the full business case would come due to its commercial nature to the Part B meeting later this afternoon. Okay, so Cyril, hands up, particularly first, please.
Thank you, Chair. I just wanted to ask, it's great to hear that we've got the the capability and all the knowledge and so on. Do we have the capacity to do it?
With if the requirements of the business case that we'll consider later, Hilary, are met, then we believe we will. And then as we grow the courses and as we anticipate through discussions with HEIW and with the Cancer Network that we would be commissioned in time to provide training, then we would employ the required clinical expertise. Then if required additionality, we have already got existing resources that we are pooling into this academy, and we'll have good economies of scale impact of that as well. So in a nutshell, yes, but we would need the full business case approved and funded.
Thank you.
Happy with that, Hilary? Ready for that? Thank you. Thank you, Hilary. Sarah next, please.
Yeah, thank you. I just want to commend the work that you've done on this, because actually it's a true, you know, especially Hannah, really, in terms of pulling all of this together. It's no mean feat, I know, and actually puts us in a really, really important position as, you know, a potential employer of choice, isn't it? Where people have to actually look at what does the organisation offer when we're trying to attract clinical professionals to come to work with us. Then this is something which is actually going to put us above the rest of the pack. And I think that the way we're approaching this is testament really to the way that we're then going to use and utilise it for the benefits of course, for patients, absolutely, and donors ultimately, but for staff in terms of their you know, their ambition and their skills and expertise, isn't it? That's what this is all about. So thank you very much for that.
Steve is next, Andrew, before we come to you. You go first. Yeah, no, yeah, Andrew, please. Thank you.
Well, thanks, Hannah. It's great to meet you, and we've seen some of this good work already at committees and boards, and absolutely support this. So I'm the university representative on the board, so I have a particular interest in things like educational provision. So it's great to see. I think I absolutely agree with Sarah that recruitment and retention is a really big deal for highly skilled professionals, and this is only going to help. Absolutely. I think in terms of a competitive package, it will have to be some in person. You know, there's an awful lot of free stuff out there of varying quality in all sorts of areas. Another important point there is linking to the new cancer centre, and there is a facility, as I understand, in the plans so you've got a base for delivering in-person sessions. I don't know, again, whether you'd have, I guess the facility will be there, and that's really important as well. So there's loads of positives. Very happy to work with you, with Nick. I've said this before on developing this as it comes forward, but very exciting stuff. And thank you for an awful lot of work that you've done behind the scenes to put this together.
Thank you, Andrew. Steve?
Yeah, just my thanks as well. I think it's a really exciting part of the development of the organisation, and I think the offer that we can make is a strong one. We'll have to learn as we go along. We all recognise that, and we'll have to assess and see what works and what doesn't work as we're new to this game. But the learning from elsewhere is really important in that. I think going back to Hilary's point, really, the important thing for the people who currently do it is it gets organisation recognition as well, because people have almost felt they're doing this because they do around an organisation is really important to us. So that recognition for me is absolutely essential in this.
Thanks, Steve. Thank you. Any more comments or questions before I sum this one up? No, thank you. So just before we get to the approval bit, just to recap from my perspective. So just as a recap, the Strategic Development Committee actually considered 3 options which were brought forward as part of the proposal. Option 1 was business as usual, a pre-proof of concept education training offer. Option 2 was a dual minimum, and option 3 was establishment of a full Velindre Oncology Academy in line with the best in the UK. And Strategic Development Committee endorsed option 3 for this board of consideration by this board. And it's that option that we're now seeking board approval for, to establish a full Velindre Oncology Academy, subject, of course, to the consideration of the business case and all of the financials and commercials, which we'll have to take in Part B. So on that basis, is the board happy to approve that? Yes, thank you. Okay, that's approved. Thank you very much. And again, thank you and very well done. Congratulations. Please pass. Again, another set of thanks to pass on to another team. Thank you.
Okay.
Right, I need to check with you. Did I say already? Yes. So we're at 9.2, but I'm going to take the liberty of jumping forward in the agenda because I know how busy you are, Mary. Thank you for joining us. Excellent time. So in terms of the agenda, I'm not going to take us on and skip one item, which we'll come back to. I'm going to take on to 9.4, which is the strategic outline case bone marrow transplant. And are you introducing this, Carl, please? Yeah, thank you.
Hi, Marera, good to see you. Save my bacon. I was looking keenly to make sure you were available. Yeah, no, okay, so I'll just say a few words and I'll hand across to Marera. So I guess the paper in front of the board just follows on from the last conversation, really, whereby it offers a really exciting, important and potentially groundbreaking opportunity for South East Wales and Wales. Fairly straightforward construct in terms of Cardiff and the Vale Health Board are developing a outline case for BMT services, haematology. As part of that development, we as a partner have been having a conversation with them about how we augment and strengthen that arrangement. And as a result of that, the paper in front of you and the supporting business case seeks to bring together the work they're doing on BMT, the work that we are doing with Cardiff University and Cardiff Health Board in terms of the Cardiff Cancer Research Hub, and finally strengthening the existing arrangements for complex specialist oncology patients who are currently receiving higher toxicity drugs, grade 3, grade 4, and looking after them. What I'm going to suggest I do is hand across to Marera firstly to talk about how exciting the opportunity is and tell you a bit about the 2 aspects we're particularly involved in, which is the research hub, complex specialist oncology patients, but also recognizing they all come as a package because it's largely the same integrated workforce which will take care and provide all of those services together. So if I hand across to Marera, and then perhaps I'll just take the last bit to talk about process and next steps. Is that okay? Is that okay with you, Marera? But by the way, we haven't yet practiced, so we're doing this live. So I think that's okay, Marera.
Yeah, thanks, Carl. And I won't take credit for the very excellent paper that you've got on this in front of you, because that was all of Carl's work. But just very briefly, the Cardiff Cancer Research Hub has, we've discussed here with Trust Board in the past, the Nuffield Trust recommendations in 2020 said that we needed to work with our partners, Cardiff and Vale and Cardiff University, to develop a hub for research over on UHW site in order to be able to deliver novel treatments, including, future cancer vaccines, cell therapies, all the things that, are now becoming, so much part of research, and also to deliver translational research with our university partners. So enabling, their discoveries to come through to the clinic and enabling, patient samples and other things from research to go back into the laboratory to kind of fuel the next set of scientific discoveries. So we brought a clinical output specification document to the board last year, and it was supported for the hub. And we've continued with work with the Cardiff Cancer Research Hub and with our partners over the last year. But, you know, fantastically, about 3 months ago now, we had the opportunity of inputting into a strategic outline case that Cardiff and Vale were putting together to submit to Welsh Government for a new bone marrow transplant unit in Cardiff. And after discussion with them, they allowed us, or they invited us, to put 2 other things in with their bone marrow transplant strategic outline case. So one is the Cardiff Cancer Research Hub, and one is a footprint for complex specialist oncology care provision over on UHW site. So in terms of the Cardiff Cancer Research Hub, the footprint, or the clinical footprint that has gone into the SOC is 8 chairs for delivery of early phase novel treatments, translational research, 8 beds, 4 of them in a kind of open bedded area, 2 of them in individual rooms that will allow us to deliver cancer vaccines and all sorts of things, and 2 of them in the actual BMT unit itself for delivery of cell therapies, you know, like the CAR T cell therapies that you will have heard of. In addition to that, so 8 chairs, and then these 8 beds, and, you know, vaccine preparation room, all the things that you would envisage that would be needed to support, you know, the workforce and the kind of, you know, the practicalities of delivering those kind of trials. But there's also, we have put in provision for 4 complex specialist oncology beds. So these are out with R&D, but they're really important. It's to allow treatment of toxicities, you know, the kind of most serious toxicities that our patients may get from immunotherapeutics, you know, and the new tranche of treatments that are coming through, and to deliver these treatments as they become standard of care. So at the minute, you know, we're talking about cell therapies and things only being delivered for solid cancer patients in the context of trials, but they will become standard of care. And so we needed provision in order to be able to deliver those things out with the clinical trials. Now, the beauty of being able to put these 2 things into the BMT SOC is that we will be able to work with hematology colleagues, learn from their experience of delivering CAR T and other treatments, but we'll have a combined workforce with hematology to allow us to deliver, you know, these treatments and this care for our patients that we need to do for the future. So I think it's exciting. At the minute, we're asking the board to, you know, support the SOC and to, if possible, provide a letter to support that SOC going in from Cardiff and Vale to Welsh Government. Of course, we don't know whether Welsh Government will say yes, but hopefully Carl, everybody, you know, on the board will work their magic and they will support us going on to the next stage, which is obviously going to be these are all now acronyms that I never thought I'd know, but OBC and FBC. So there we go. FBC is really full blood count for a clinician, but it's now full business case. Carl, I don't know whether I've left anything out.
Oh, that's brilliant. Thanks, Mary. So if I can, I'll just finish off and then we'll open up for discussion. So Mary's described it superbly. Just a couple of things in terms of the actual business case itself for the board to be aware of. First, quite clearly, is Cardiff and the Vale business case. So we are an important partner, but a partner nonetheless. In the option of the options, there's 4 options at the moment. The desirable option is the BMT with 4 specialist oncology beds together with the Cardiff Cancer Research Hub. So that's the preferred option at the moment. The last bit, in terms of the costs, they are, you know, not insignificant. So the preferred option, the capital costs will be around about 60 million. And there's some quite significant revenue costs in there as well. The 2 which we would be broadly responsible for are relating to the oncology beds, 1.9 million. They're not for oncology beds at the minute. They're like for like the BMT beds, but they're close enough. Then also the Cardiff Cancer Centre Research Hub, which is around about 2.2 million. So that's that. The other thing I just want to bring the board's attention to is the 2 things running in parallel. So we have the capital case going in here. But as you're aware, we're also doing the tripartite work with the university and the health board on the research hub. And we've had 3 great workshops. Andrew's attended all 3, and Jazz would be waxing lyrical like myself if she were here as well. There's a genuine excitement that for the first time, the 3 organisations are working together and can do something very significant and special. So what we're trying to do is to make sure that aligns to this piece of work. So we've got 2 bites of the cherry. Either this goes in and gets approved with that preferred recommendation for the capital or not. Irrespective of either, we still have to get an investment strategy which closes the gap on the research hub to make it sustainable. So we have some choices around commercial and non-commercial trials and the split and what we go after first. And then secondly, who and how we go and seek for strategic investment over and above those we're already aware of. So those things are coming together over the next couple of months. So really what we're asking the board to do is follow its considerations. It's fairly straightforward. It's just to note most of this. What we are seeking though is the board to approve a letter of support for when this goes into Welsh Government. So Cardiff are also having this paper in their board today. They're seeking from us a letter of support, which will go alongside the SOC, which does carry some significant weight. So I'll pause there and hopefully Marera and myself, Matt to a certain degree, because Chris Morton has been instrumental and fantastic in this work as well, amongst many others. So just happy to pause there, Steve.
Okay, thank you. So thank you, Marera, for running through some of the important detail. That was most useful. And Carl, you summed up at this point exactly what the board's being asked to note and agree to. I will come back and recap all of that shortly. Vicky.
Yeah, very supportive of this. I guess for an outline business case, you wouldn't need 7 levels of assurance. So whoever's been editing these papers, putting level 6 outcomes realised in full, hasn't quite got a concept of what the paper's about. So just to note that. So that just needs to come out if we could, but very supportive of it. Thank you.
Thank you. I've got quite a few hands I took away up. So I think Edwin, you were next. I think Catsan was up after, but no.
Thank you.
Well, certainly Edwin, you were next. Yeah.
Just say definitively, I'd imagine pretty much all clinicians working in the trust would support this. Certainly Jazz does. There were just 2 subtle things I wanted to point out, which actually I think maybe don't come out, but strengthen it even further. The first is that we take page 13 out of 119, section 2.2.2. Another, in terms of the strength that Velindre bring to this, also include our, we also collect stem cells from unrelated donors in the city of Cardiff, which is a synergistic potential. We provide the compatibility testing for related and unrelated donor transplants and potentially unrelated and related cellular therapies for the whole of Wales and, well, most of Wales, let's say. And we also obviously provide the supportive therapy, which has got potential for research in terms of 70% of platelets go to patients with cancers and 30% of red cells go to patients with cancers. So I think those are important synergies that further strengthen this. And then on page 50 of 119, the points, if this service was to be lost to Wales, points 1, 2, 3, and 4, I think point 4 highlights the fact that that would affect the outcomes of patients, which is the most important thing of all, obviously. But it perhaps doesn't, I mean, it brings out the reason for that being the outcomes are currently good, despite the issues with facilities and staffing that are currently challenges, and that that sort of that preparation of people who may be older or have comorbidities has been part of that. But I think the other thing that possibly more, if we did lose it to Wales, it would kind of assume that those facilities, space, nature facilities and staffing exist in England at the moment. And so there were people twiddling their thumbs, there's space available in Bristol, Liverpool, Cambridge, somewhere in England that could just take these patients. And I can pretty much guarantee you there isn't. So I think the impact on patient outcomes may be even more drastic than that would suggest.
They're excellent points. Really good points. And I think, you know, the next step will be the OBC and the FBC, and I think those, you know, the important synergy with Welsh Blood Service, we need to kind of get that in. I mean, the SOC has been written by Cardiff and Vale, and it's been quite difficult sometimes to kind of influence and have, you know, an input, but we'll absolutely make sure that that goes in to the next piece.
Thank you. Checking my list. So I got Andrew as next, and then Gareth. Thank you.
Thanks. Also, Edwin, great point, and I think that whatever form the Velindre, the letter of support that goes, it absolutely should reflect the Welsh Blood Service and the contribution that makes to actually the whole unit, isn't it? So I think that's important. I'm just wondering, because we're talking a lot about facility, and of course what we're also going to need going forward is highly specialist staff and additional staff, and I don't know whether it's too, I know we have plans in that direction, but I'm still, is it worth saying something here to the board about the kind of people we'll need to staff this facility, where they'll belong as well? Because there are some, you know, whether they're between Health Board, University and Velindre. So that's another part that will come through in the business case. But you know, we all these things are easy, but we have to do it because these are the therapies of the future that we're going to need to for patients. So anything on staff?
I suspect Marera, given that she's got numerous hats on, so you're probably best placed to make some useful observations on that, Marera. We did talk about that in the last couple of workshops, haven't we?
Yeah, we have between the three organisations made a workforce plan for the Cardiff Cancer Research Hub, not for the complex specialist oncology beds yet. You know, Cardiff University have funded a number of our pharmacists, nurses and consultants to go to other centres across the UK, to Manchester, to Newcastle and to Guy's and Tommy's in London to learn about delivery of cell therapies and advanced therapies to solid cancer patients. So I think that's really important that our workforce is getting trained up now. We have funded from Velindre, from charitable funds, a link partnership nurse, Claire Lang, who works between Velindre and Cardiff and Vale and chairs an operational group, which is all about, you know, choosing the right studies to bring in now and then in the future, and making sure that the staff is working across sites and that we have the right expertise. But it is something we are going to have to employ some new staff. Velindre, you know, particularly through charitable funds, has been fantastic in providing us with funds in order to be able to make some early appointments, and we will continue to do that now over the next you know, year or two. We've just advertising soon a new clinical academic position in immuno-oncology, jointly funded between Velindre, the Wales Cancer Research Centre, and then Cardiff University. So that's a really, really exciting position for us and part of the kind of clinical leadership team for this. But, you know, our nurses are working really closely with the haematology nurses who are delivering CAR-T therapies and other therapies and learning from them. And so I think this kind of joint nursing, HP, medical, pharmacy workforce is just going to be really important for the future.
I think it picks up on the point this morning, Andrew, somewhere around looking at what's the overall workforce plan for the next 5, 10, 15 years. It's happening now, isn't it? It's happening. So I think it's in that space that needs to be part of those sort of considerations, I guess.
Yet another, you know, they could be trained at our oncology academy in the future going forward. Why not? You know, this is another reason. You know, we're going to need staff at that high level of skill and training. Yeah, so this is good.
Thank you for that. Gareth, please. Thank you, Chair. 2 questions, if I may. First of all, unless I missed it, I don't think we've seen a draft of the letter of support to the SOC. I'm assuming that it's not going to commit us to any financial expenditure at this stage. And it'll be in the high level terms.
Strategic support.
Strategic, okay. So that's first.
It's not written yet, Gareth, that's why you haven't seen it. So I can have the outcome of today's conversation, but there's no financial commitments other than our officers' time at the moment. So there's an opportunity cost there, I guess.
Okay, thank you. That's fine. And then the second question is, the last time I think we heard about the Cancer Research Centre, there was talk about some heads of terms that were being developed. And I'm assuming that there will be similar heads of terms now for the bone marrow element. And because I think, as we said last time, it's important, while everybody is enthusiastic about this at the outset, to get clarity around who is legally obliged to do what. Andy touched on who employs employees and things like that. And I'd be keen to hear about where we've got on that journey, because I wouldn't want that forgotten, the legal bit.
Yeah. So there's two slightly separate issues here. So starting with the first point, there are, as you say, heads of terms, MOUs well established for the Cancer Cardiff Research Hub, because that is a new tripartite arrangement. And interesting, when we took this to the tripartite board, I think it was last week, interesting conversation. We get into detail on it, but actually who's sharing only what risk financially. So that will drive that conversation around clarity, which is slightly different to the bone marrow transplant specialist oncology patient bit, because that's happening today, Gareth, and there was a commission, the care pathways in place. This is really, in essence, making sure that from Cardiff's perspective is sustainable, and we're just adding a bit to that. So I don't think there's a need for heads of terms. They're just all essentially normal day-to-day clinical service activity. The bit we do need to work through for ourselves is you take the 4 specialist oncology patient beds, there will be a discussion about are they already commissioned and paid for, or is it new work? So there's a slight little bit around that, but it doesn't require anything new over and above what's already in place. But the CCRH will. The other thing, just to bring you up to speed on, I think colleagues may have had a chance to have a look at it. There's also some really quite smart branding being developed to start to bring that as a package we can go out there and sell to some potential investors. So have I answered your question?
Partly, okay. Not fully. I guess the question is when will those be developed fully? Okay. Because the heads of terms or MOUs, when will those be moved to the extent that they can be formally legally binding arrangements?
I think it's probably two different. One is the research hub as an entity will need something, and that absolutely does need something. We did touch on that last Friday. We had a very energetic and enthusiastic meeting of the 3 parties involved, and clearly again a little bit more challenge when you get into some of those issues. For the actual service part, it's not the way we approach things historically, but we will have to sort out some things for the OBC and the other parts, which will be absolutely the things you'd expect to see in a heads of terms. So I think how we go about that might be a slightly different form from what you'd see as a commercial norm. The component parts, like who's responsible for what, where a risk gets transferred, we've got to be clear about whose staff people are, what they're going to do, what they're not. So it's some tricky conversations to cap, but I think the sorts of things you'd expect in the MOU, we're going to have to work through. So it might come through in a slightly different form than you could expect.
I mean, we are used to, as clinical staff, working across sites. You know, we have honorary contracts with our health board partners, and we're always over doing clinics and all sorts of things in other health boards, but we're, you know, employed by Velindre. So I think it's just an extension of that for, you know, the service piece of it, right? Carl, you're laughing at me. Or...
I'm not, no, I was nodding. I was nodding. Smiling and nodding there. I never do that.
Honorary contract, I've thought with the
Yeah, I mean, we'd be working for Velindre over on another site, right? That would be, because there are patients that we're looking after.
Yeah, absolutely. And I think we're right. I mean, laughing because I can see Gareth's shoulders tensing as we were talking. It's about building on that norm as a way of working, probably around this, because the issues we're going to be managing for them, which is need to be a bit tighter than some honorary contracts, which I think we all agree on anyway. And we'll have to unpick those as part of building the service model.
I'm sure this conversation will re-emerge at some point, so yes, thank you. It's been very helpful. Are there any more comments or questions on this before I sum up and then ask the board to either note or agree things? Not. I'm going to, obviously it's important to be very clear on what it is we are noting. So I'm going to weave in some of the clarity we've had introduced in the discussion into the points the board's going to be asked to note. So as well, as Mairead pointed out, obviously this is the first of 3 stages of business case. She's also expert on the other 2. So this is the strategic outline case, and that will in due course be followed by the outline business case and the full business case. So the first thing we've been asked to note is the progress made, I would suggest, liaising with Cardiff and Vale in developing the Cardiff and Vale SOC and the improvements it delivered to the quality of cancer care and the expected benefits for patients and staff. Be happy to note that, yeah. Then note the development set out in the SOC, which, if they proceed through delivery, will address a range of national policy issues, Nuffield Trust recommendations, together with the strategic priorities of the various partners, and I would add potential synergies with the Welsh Blood Service. Be happy with that. Thirdly, and Gareth's point, you note that no financial commitments are being sought at this stage. And then fourthly, to approve the provision of a letter of support which reflects these conversations for the strategic outline case to Cardiff and Vale UHB, which they will send to the Welsh Government to support its consideration of the SOC. So are we happy to approve that?
Yeah.
Okay, and I will leave the minute secretary or team to form the words from that from the recording. Right, thank you for that. And again, thank you, Mairead. That's a good step forward. Obviously, we look forward to further updates as these things unfold going forward. So thank you very much.
Great. Diolch yn fawr iawn. Thank you. Nice to see you.
Right, that concludes item 9.4. So I'm going to take this back one step now to item 9.3, which is the framework scheme of delegation for major capital programs, which is Matt correctly reminded me is coming to the committee through, coming to the board through the audit committee, having been referred to the audit committee as it happens by myself through the TCS subcommittee some time ago. That's correct, yeah. So over to you, Matt.
Okay, thanks, Chair. So, as you say, the purpose of the paper is to set out the proposed framework scheme of delegation for major capital projects and programs. So, I mean, as the board know, the trust is going through major levels of strategic change in terms of major capital projects and programs, either ones that are being implemented, such as the UVCC enabling works and the IRS, and also ones that are being developed as business cases, either in their final stages, like the UVCC, or about to commence development of cases like the WBS modernisation. So this scheme of delegation is very much about those major capital projects. It all stemmed from 2 aspects. One was an internal audit report back in December 22 around the UVCC contract management into the professional services. That report identified a number of issues in terms of contractual commitments and how those contractual commitments have been made, out with normal governance processes in terms of standing orders and exercise. So that meant the board had to sign off those commitments on an urgent basis out of their normal processes and cycle. So the Director of Finance, myself, and my deputy basically met with our procurement colleagues and internal audit and liaised with 2 other health boards who have also recently encountered similar problems on their major capital programs. So it's not great that it's happened elsewhere, but it's helpful in terms of learning lessons and in terms of what they've done. So we looked at all of the processes they've gone through in terms of how they resolve the issue. So essentially from those discussions, and as obviously Stephen pointed out, he recommended also a review be undertaken via the audit committee. So as well as the internal audit report, I also undertook a review. Gareth and others were involved as IMs in terms of scrutiny of that review in terms of the issues. And both of the conclusions actually came out of the internal report and my review about needing that this scheme of delegation below the board once the board had approved a full business case and well, government had funded that full business case in terms of capital funding. So that's what this process has come to. So on page 2 of 8, essentially it sets out matters of consideration. The rest of the paper picks up. So it talks about, well, what we're on about when we're talking about major capital programs, and that's all driven by the Welsh Government better business case guidance largely. So there's nothing new in there. It's just that's how we framed what we're going to say of a major capital project. Then there is the development of the what we scheme delegations in section 2.2, which talks to how we've gone about that. What the key components are set out in 2.3 on that scheme of delegation framework, and then the key roles and responsibilities in 2.4. So I'm not going to go through 2.1, so just describe what that does is essentially saying how the Welsh Government better business case. So at the moment we were talking about items 3, which is the 3-stage business case, which is values over 2 million as a starting point. And that's because the 4 cases that I listed that we're already in the midst of are in that vein. However, best practice would suggest that we actually start to do it for the medium size business cases as well, and some of the low, given that they go up to 200k. And of course, at the moment, our chief executive only has 100k of it. So let's start with the ones that we're focused on, because we've got 4 big business cases. That's the first section covered off. 2.2 is then really about how we were trying to design the framework to address all of the issues that we raised, and it sets out the process that we went through in terms of trying to do that. So what you have is a sort of a process diagram attached to Appendix A to help you understand that process and how we come up with a governance framework. And Appendix B, which is a live example, which is the IRS one, which is pretty urgent given that we're, given papers that you've already seen and already in implementation phase full on. So the urgency of having this framework or to help, I suppose, operational decisions made around the actual funded business case. So it's been developed through the following approach, as I said, looking at the internal findings. And not just that, just our standing orders and SFI set out a whole load of requirements of governance around capital, major capital projects. So, it's not like we're starting with a fresh piece of paper here. We have governance already in place. As I said, the lessons learned from the 2 health boards and using some of their documentation and some of their program controls have informed what you've got here. And then, as I said, the IRS one is there as a practical example of that. So the key components set out in 2.3, you've got 10 sections essentially, and I'm not going to go through them all. They're hopefully pretty obvious in terms of the governance process that you expect to see. As I said, if you want to see a live example, not live because you haven't approved it, but an example of how it would work and the level of detail you'd expect to see in one of these frameworks, that's in the IRS example. And then finally, the roles and responsibilities are important. Set out in 2.4, chief exec is the accountable officer for all major capital projects. That's set out in our standing orders and SFIs. And the scheme of delegation that would flow if you approve this framework would be one that our chief exec would then set, and only he could set in terms of that framework below, in terms of what gets approved. Got the different roles there set out for you. So I suppose it's about discussing the review, just to be assured, the audit committee did a fair bit of time discussing this, and there are concerns and issues that were raised with the audit committee. I suppose my assurance to the committee is it's going to be a robust framework, and it is all based around funded business case from Welsh Government, and it would be done in obviously blocks. So it's not about just carte blanche saying, well, off we go and spend full amount of the business case. It's about from looking at each element of the implementation and having a slick process though that provided those commitments being made within what the FBC was signed off and what you've been cited on. Clearly, if there's anything outside of that, it would have to come through a different loop, including involving the board. So it's not about just spending, you know, from one part of the case on something else. If it underspends, there needs to be some process about involving the board. This is about where you've got a limit, there's a budget for it, and you've been aware of it, and you've approved it. It's getting that process going really slick in the operational sense.
You want Gareth, please?
Thank you, Chair. Just the other bit of context which Matt alluded to was that there was a thorough lessons learned document which Matt had prepared as well, following the contracts we were asked to approve retrospectively at TCS and subsequently board. So this document builds on that, and as Matt said, gives the framework. It gives some flexibility, but within the confines of the FBC and the funding that's been approved there, and isn't a free-for-all for the project team to go off and contract with whoever they want. There is still the assurance there for the board that it is within the overall financial envelope.
Vicky, please.
I think just to ask the question, Matt, in terms of those assurances, does it pick up all the recommendations from audit?
Yeah, I mean, internal audit, the main one was about, well, sorry, there was two. So one was about the contract management schedule to make sure we were on top of our contracts.
Yeah.
And then if you're on the TCS scrutiny committee, you would have seen that there is much better reporting around the contracts and where we're at. But my main point is, you know, you should know how much money you've earned on a contract. You should be monitoring tightly. You should be coming back to TCS scrutiny regularly with that monitoring and explaining why we're burning through it at a certain rate and why we will need more, often around further works, as we know, around this UBCC project and the enabling those projects, and also delays, which also require you to extend professional advice. So that is in place, but it's still, you know, it can improve, but it's there, it's better than it was. So that was one. And the second one was, look, they'd seen the two of the health boards and the problems they had, and we fell into the same issue. And the things that they've done to correct that and said, look, a framework that's delegated by the board, wrapped around what the board has approved and what's been approved, is the way to go. And that was a recommendation.
So what we're saying, just from my understanding, we've got the recommendations by internal audit, you've got the benchmarking, which then puts us more into sort of best practice and learning from others, and then the clear framework that gives us something to hang that on in terms of board discussion. Yeah, fantastic. Thank you.
Yeah. Thank you, Matt. Any comments as well? Sorry, Hillary. Hillary, please.
Yeah, thank you. Sorry, I know I haven't been, I'm not on audit committee, so I'm not aware of how much discussion has been had around this. So sorry if you've already covered it off. But in practical terms, how would we see the difference now from where we were approving increases in contracts on the works, you know, around the NBCC, advanced works, etc.
I did it within the business case had a professional services fee in it.
I can't hear, sorry.
So in terms of the FBC that the board signed off, there's various elements in there. So but the capital items which are split out in great detail. You've got, if I take the RS for an example, or the new VCC, you've got elements which we're not in the space of yet, which is spending money on capital items, but you have also got a whole section of professional fees, which funding was approved by Welsh Government and the board. So we've been in a situation, even though it was within the budget that Welsh Government had approved, it was out with the original contract value, so we were having to come back to the board. Now, provided the, I suppose, the spend is still within that professional services envelope of budget, we wouldn't be coming back to the board. That discussion through procurement, so it'd still have to go through a proper procurement route. And I wouldn't sign that off, or nor would Steve if it hasn't gone to that route. But it could be approved as an extension, provided it's within the procurement rules, without having to come back to the board. And it may be over 100k. And that's the difference, whereas it's coming back every time.
Yes, and I think what you said also was that there would be greater transparency for,
Yes.
take the TCS scrutiny committee. There would be greater transparency of the spend and the individual contracts as we're going along. So you might make the decision to increase the spend under a contract, but you'd still be coming to the committee and saying, this is what we've done.
Yeah, that report won't stop. So the report that's going to the TCS scrutiny committee on the contracts. I mean, we're focusing on the professional services, and I understand why. But this framework is much wider than that. I mean, that's a tiny part of the spend. You know, in terms of, you know, we got Linux going out the door with software and big capital items on the IRS, and we're focusing on professional services. And I understand why, but it's not the be all and end all of this framework. You will still get that monitoring of the whole of the professional services contracts through the TCS scrutiny of any decision that we've made to increase the contract. And if it's out with the budget, Steve and I ain't going to sign it off. So if we're waiting for funding from Welsh Government, it won't happen. So you know, so
I think it, for me, Steve, it's a good balance of agility to move, but also accountability and governance as well. And that's where the two things sit side by side. And we have started the reporting.
And just to confirm, so this is the case for the enabling works business case, but clearly not the case for the MPCC. That hasn't been signed. The FPC.
well, no, the framework, there's two things here. There's a framework that I'm asking the board to sign off, which will apply to any major capital.
Yeah, it's just used as an example of the NBCC, FPC.
Yeah, sorry, that was my apologies. I should have said enabling works, not NVCC.
The enabling works will have been signed off. I guess you really want to, I mean, obviously, I use.
Yeah, just for clarity, because it's not a version of the FPC thing.
What you've got there is the IRS one, is the appendix, which is the live one.
Yeah,
I would like to have approval for, so we can actually start using it in reality, because there are decisions that need to be made around commitments within the framework of the business case you've already signed up.
Yeah. So can I ask a question on the back of that? If this scheme delegation is signed off this afternoon, would that have meant, if it had been in place a month ago, say, would the acceleration of the Linux 3 machine, would that have come here for approval, or would it have been just reported for information? I think
I would say the acceleration bit would come. If it had been a normal implementation of the second Linux, I would see that as part of this given.
I would, yeah.
It's an important decision, isn't it? It's not just about the money. It's the
but arguably it would come within the scheme delegation. Okay.
Can I just add to that?
I know that's not a good enough answer, but there's no way.
Before you do, Kathy, I guess my observation is what we've been asked to do is to approve the acceleration of the scheme, because we'd already previously approved the acquisition of these two accelerators as part of a bigger business case. So I do take the point, it would be very important then that the board was given the opportunity to debate and authorise a change to something that's previously approved, rather than specifically a spend which is effectively approved. You want to add to that?
Yeah.
Or disagree with me?
No, I absolutely agree. And it definitely would have come because within the context of the framework, it's a material change. And so in that case, it would come. It's a material change that then needs to be supported through a range of other things, including engagement with government around the assurance that we've actually got the funding to enact it. So, I absolutely, definitely that where it involves that contractual change, it would need to be brought to the board.
I was going to say that is the point that the first two were what you signed off with before being implemented in the UBC, the third wasn't. And it does actually have a different financial impact because it's going to add to the bunker implementation costs that we originally had in the case already for two. That makes it 3 and a transfer. So that one definitely would come. The fact that we had money in a different part of this case is not enough for it to for us to just do that on our own. That would come here.
Still have your hand up, Henry. Did you have a further question, or is that legacy?
I suppose I'm just going back to where does it say about the reporting of it in this scheme of delegation? Am I missing that?
Well, we can add something in that says about the normal reporting and governance lines for each of the various capital projects and programs. If that would give you more comfort.
Yeah, so I mean, it can go in here. I think what we're doing is addressing the second recommendation, back to Vicky's points. This is dealing with the second part. The first part, we've already actions. But we could put something in about reporting on contract management, and that's fine.
Well, I think it just makes it a bit more transparent when we're asking about how will we know when you're saying you're going to report. I just think it's right that it's in there, that the reporting of it is embedded.
Good point, you agree that, yeah? The update. Thank you, Hilary. Any more questions or comments before we sum up on this one, what we're going to ask to? So in terms of training scheme delegation for major capital programs, we've been asked to discuss and review the proposed approach to development of model schemes delegation and governance training for major capital projects and programs, which we've done. And consequently then asked to approve the approach and application of model scheme of delegation and governance training for major capital projects and programs for all major capital schemes, and we're asked to approve the integrated radiotherapy solution program scheme of delegation and governance training, which is an example, a worked example. So subject to all of the discussion and comment we've made and the Hillary's reference around around reporting, are we happy to approve on that basis? Thank you. Right, that concludes section 9, and it gets us now on to section 10. And this is the consent section. As a reminder, these are documents which will be taken as read and which are used for approving or noting.
Sorry, there are the standing orders one because we can bring it right to cover it. I've got lunch. I need to just come out because of comments at order committee.
Right, okay. So let me just ask the question then for me. So in terms of the first, I think there's 5 here for including the variation of standing orders. It's 10.1.3 specifically, is it?
Yes.
Okay, so we're going to take 10.1.3 out of consent. So in terms of 10.1.1, 10.1.2, 10.1.4 is the shared service.
Yeah, that's okay.
That's okay, and 10.1.5. So those 4 items are here for consent. We're going to take 10.1.3 out. Does anybody want to take any of the other 4 items out of consent for discussion? Or do we approve them? I'm going to take them as approved. I will come back to 10.1.3 in a moment. Then in 10.2, we have a number of items, papers, reports, etc., which are here for noting. Does anybody wish to take any item out of the 4 noting section to discuss or comment on? Seeing any hands? If not, I will take them all as noted. Then takes us back to 10.1.3. So we take that out of consent, Warren. Are you going to speak to this?
Yes, it's two points from audit committee. So one is it's not just you, Carl, it's also Welsh Government in picking up spelling mistakes. So the model standing orders which came through from government do recognize the typos which feeded back. And secondly, there's a good point raised by the members of the committee that we left in all the changes to the trusts in WAST, so which is unnecessary. So so for clarity, we will recirculate it just with the trust ones in there and with the typos corrected, and that will then come through.
So do we approve it out of the committee then? This is recirculation.
approval of the committee or approve today's.
Oh, no, well, it's there, it's just taken out the West.
Okay.
Yeah.
Okay.
Well, we've clearly never put that in the actual standard orders, it's just a bit clunky for the paper, isn't it?
So just for clarity, in terms of Martin's question, we're going to be asked to approve the variation standing orders subject to specific sections not related to us.
Yeah.
What form of words are we going to put in the minute?
I don't think it needs to be subject to, we would never put the West stuff in our standard
Okay.
orders, it's just.
So what we've been asked to do is approve the adoption of the revised model standing orders, reservation and delegation of powers for NHS trusts as relevant to this particular trust. Yeah.
Again, so just for completeness, we can say that we noting the amendments that were raised in audit committee.
Yes.
Because then that's just closes the circle, not subject to, but it's noting.
Happy with that? Yeah, thank you. Given the time constraints, I'm not going to propose to read through the individual considers authorised endorsed all of these papers unless I need to. Just going to take the other four as approved and the others for noting as noted as described in each of the recommendations. So we happy with that? Yeah. Right, that gets us to the end of business. 11, any other business are not being notified of any other business. I'm not proposing to take any. So that gets us to the date of the next meeting, which is Thursday, 28th of September 2023. I now propose to close the public meeting of the Trust Board by adopting the following resolution: that representatives of the press and other members of the public be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest in accordance with section 1(2), Public Bodies Admission to Meeting Act 1960. I draw the meeting to a close. Thank you.